Okay. All right. Allow me to start up because time do not allow. Probably we are planning to finish we before stipulated time. But again, I would like to thank you all for taking your time and being part of this important discussion. Because if we don't stand at the gap of digital wellness, then to me we have a community that is living in a living in a hard situation, community that is struggling mentally. Okay, so I can see, I'm just trying to buy a bit of the time, but I can see our speakers are all here. Our keynote speaker, Dr. Catherine, is here. Valentine is here with us. There are just few speakers who have not joined, and they're finding some difficulty joining, but they're joining just in a few. So for the meantime, I'm going to do housekeeping rule. Then after which I'll start up immediately with the opening remarks. Yesterday we had a very important engagement with the team, and the first session was just insightful, and I'll be able to brief about the outcome of tomorrow's session, and now to start up and charge for today's session. And because we normally respect these session, the registrations and the people who will be participating in these symposium, we have people from different countries, and for that reason, ladies and gentlemen, allow me to play national anthem. If it allows, then that's okay. If it does not work, then we'll just continue because sometimes technology sometimes does it. Okay. I'm sorry for
I'm
that
sorry for that
technical. technical hitches.
Okay, ladies and gentlemen, good morning, good evening from wherever you're joining us from. My name is Collins Dundo. And
Okay, sorry for that. I didn't know I was on mute. Thank you once again. The attendees will be on mute while the session will be on. And also we request you to be polite, and we request you to engage a lot on the chat so that we make this virtual discussion very lively and very fruitful. I request you all to also observe time. Even our speakers, we request you to check on time, the allocated time, make sure that you use it effectively. Again, the session, we have two sessions today. The one touching on the inclusivity, and then another one touching on the workspace wellness, workspace school wellness. So I believe that you will find time, get good time, and you will spend time with us up to the end of the meeting because we have a very important announcement even to make at the end of the session. Ladies and gentlemen, at this time, allow me to go straight to my opening remarks before I welcome our keynote speaker, who was not able to be with us here yesterday because of our work. She was traveling, and this is somebody who is well known in the space, and I believe her insights will change the direction and will shed light on the discussion and the theme that we are having today. So yesterday's symposium was not just a symposium, but we ignited a continental movement amongst the delegates who attended. And also, I am thrilled to report that despite the technical glitches and some institutional absence, the coalition of the willing stood strong. We saw over 100 high-level registration and also maintaining a constant discipline of over 60 decision makers per session. That was throughout our our opening. And look at um, the geographical of our resolve, the people who attended yesterday's discussion. We had people coming from Kenya, Uganda, Ethiopia, from Nigeria, Ghana, Sierra Leone, Tunisia, Burkina Faso, and DRC Congo. And also, we even reached across Brussels. We have people who came from Brussels and the UK. And I strongly believe, even right now, today, we will be able to go beyond. And I strongly believe that the rest will also be able to join us while we are continuing with the discussion. So as I mentioned in my opening remarks yesterday, we are standing inside human digital revolution. For the first time in history, an entire continent is dreaming through devices in the palms of their hands. Children are born today, and then the very first thing that they are handed over is a phone. We have several cartoons, Cocomelons. Yeah, so you can imagine but we must keep asking the haunting question, at what cost? If you go everywhere in our workplaces, we've gone digital everywhere, which is good again, but at what cost? That's a question that I would want all of us to think about while we are continuing with the discussion. So we have we have successfully upgraded our software, that is operating systems within us. But I'll want to say that somehow we have downgraded our human biology, and that you will know if you were here yesterday through the data that were shared by Francis Agichaba. It was alarming to see that. And I strongly believe through this data, we'll use it to inform some of the some of the directions that we will take as an entity. And also, we have again time to time, every hour we give to the screen is an hour of bodies stand still. It's like now we are seated and we are listening. But again, in this session, we are going to encourage wellness in between some breaks for refreshment, whereby will be required of you to stand, stretch a little bit, go grab a glass of water. Maybe if you have some tea with you, also you can enjoy it. And ladies and gentlemen, let us honor the wisdom which was shared by Francis, like I mentioned. Francis is the CEO One Plus Africa, and then it proved that sedentary digitalism is our new metabolic reality. And you can you'll realize young people themselves were able to make even suggestions on how they will want to be helped. So to me, every stakeholder in this room, you really need to play a role in helping our next generation. We really need to play a role to help to build a sustainable and healthy community that will enable our young people to thrive, because digital is just an environment on its own, and digital hygiene is something that we really need to start practicing as soon as now. And also, we also check on how parental play, the role the parental play in ensuring that even they check on the consumption of some of the consumption of some of the work. I'm sorry for that. Consumption of what their children are watching online. So it is alarming, or 40% of the parents do not check what their children are watching online. And around 20, I think they didn't know. But anyway, it's something that we really have to be discussing continuously, so that we bridge the gap that we have in our community. And again, I would like to upload to Dr. Kendi, who represented Dr. Zul yesterday. And her insight really reminded us that dopamine loops are not an accident, but also they are designed. We heard from also Winnie Rachel Atieno from UNICAF, also who gave some great insights on e-learning wellness. And also we have great insights from Olabode and also Nolin, who also give shed lights on the psychological shield of digital safety. And there are some good suggestions that if time we will be able to share in the report that we will compile after this. And while I was also checking on the charts, something I noticed, which was a game-changing moment on the chart, is a comment that was made by Lena from Brussels. Lena reminded us that digital literacy is useless if we do not regulate addictive design, right? And also, Lena, I strongly say that your insights is something that will really take serious, and something that really will inform even a bit of the policies that we will want to revamp out of this discussion that we are having today. Again, allow me again to come to something which is very important. It's about the CoDEW, the Coalition for Digital Education Wellness. This is a child for partnership and a child for youth initiative development program. And we strongly believe that this child will be independent this child will be able to start flying and also engage with different stakeholders with your entities, with the ministries and the private sectors, so that we're ensuring that we play a role in ensuring our digital spaces are safe and are healthy, and also our young people are also safe and healthy, but ensuring that we revamp and we integrate digital wellness and or hygiene in our places of studies and in our places of work and also in our home. We are urging that I would like to reiterate that immediately after we form the Global Advisory Board, which I mentioned in my previous opening remarks yesterday. And I encourage each one of us to be able to apply so that we have a team of experts who are able to anchor their voices towards a digital wellness within your country and across. So we also will want to launch Afro Digital Wellness Startup Fellowship immediately after we form the board. And also we have partners who have come on board to be part of and parcel of CoDEW. And through that, I strongly even invite the experts that we have here in space that you can also help us even in revamping curriculum that we will use. So we plan to have one unified African digital wellness curriculum to run across all 54 countries. But again, through the formation of workforces in each and every country members should stick towards advocating and ensuring that wellness it's something that it's given digital wellness something that's given priority in every sector of your or in every sector in your country. So today we move from behavior to system, and we have curated two high stakes panels to give us total clarity. And just to give shed a bit of light, what is expected today, we have two sessions, and one session is the AI inclusive access and PWD wellness gap. And we have a very good speaker with us who will give remarks, keynote, that is John Otieno. Immediately after Dr. Caroline, John Otieno will take control and will shed light. John Otieno is representing the NCPWD department. And our moderator, Valentine, who is AI and Health Summit podcast founder, will moderate the session. And we have Dr. Demian, who will be in the panel, as well as Lillian Mutegi, who is the Uptake Consulting, and Agnes Wangui, who will shed light of a real life situation. She is an entrepreneur and also digital wellness advocate. So we will prove that digital future should be inclusive, and persons with disability should be given priority and dignity and respect that they deserve. And session two will again touch on the future of work, education, and wellness ecosystem. Collins Dundo will be moderating that session. If you don't know Collins Dundo, it's gonna be the moment too. And we'll bring experts, that's Mr. Craig Delage and Victor Prince, and also Maureen Gikonyo, who will also shed light on how we can build a well city or digitally well city within our countries and within our cities. So we will define the rights to disconnect and the curriculum for digital immunity in our schools. To conclude, I am calling for leaders to head the digital wellness workforce. And in your respective countries, we need a team in every sector, and also to drive monthly local interventions and apply for the Continental Board of Directors that I mentioned even in my first statement. These on my final rule, I'll say, ladies and gentlemen, it is the moment and now, and don't be rigid, don't be hard to yourself. If you feel like you are tired, we encourage you can stand up even while the session is going on, stretch a little bit, do some jogging if possible where you are. If you have enough space, I think the reminder that we did, you really need to have a very good space for that. And we encourage you to even start doing that in your work environment. And maybe you can get tools that people can use at work environment, whereby they also need to stand up while walking. There are a lot that we really need to again check on in terms of the rate at which NCD it's rising, and I believe our keynote speaker will be able to share that light. So at this point, ladies and gentlemen, allow me to welcome our keynote speaker of today. This is somebody that have really followed so keenly her work in towards bridging the gap or reducing NCDs within the country. And this is someone, it's a titan who really ensuring that we are well and ensuring that the policies that we have in our country aligns and also help each and every individual to be very healthy in whichever area that they work in. So at this moment, ladies and gentlemen, allow me to welcome Dr. Catherine Karekezi. If you're there, kindly unmute yourself, and then the floor is yours.
Good afternoon, good morning, everyone, depending on where you are. Thank you, Mr. Odundo, for that kind introduction. And thank you for inviting me to give this presentation. And apologies, I wasn't able to join yesterday. You seem to have had a very lively session. And I believe everybody was well educated about various aspects of digital wellness. You can hear me okay?
Yes, you are loud and clear.
Yes,
Thank
yes.
you.
Continue.
Okay, yeah, sure. Am I able to share? Okay, sharing is not turned on. Yeah, so as I was saying, as I wait for rights to share, you seem to have had a very engaging afternoon yesterday. And once again, apologies that I wasn't able to join. Now let's have a challenge here. It's this one. You can see my screen? Or not quite.
Yes, we can see your screen.
Yeah, it's feasible now.
But it's not on slideshow. Is that okay now?
Yeah, of course. Clear.
Okay. Yeah, so thank you very much for the invitation.
It's not on presentation mode. Kindly put it on presentation mode.
Oh, it is on, it isn't.
Yep. Yeah, click that.
And now?
Not yet.
Okay, maybe I need to close some windows.
Just click on slideshow, the above bar that says slideshow. We should be able to get it.
Okay, you're saying which bar?
Just as we were sharing initially, there's the top bar that there's slideshow somewhere. Click that. All right, just below that.
Your
Next.
screen sharing.
On your, I think on your side, it's on your left. Yeah, that.
This one with a downward arrow?
Yes, just click that slideshow.
We had a problem with this thing last week. As you can see, I'm not very digital literate, but anyway, you're still on the but you can see the screen itself.
Yes, we can see the screen. If it is not able to project, you can still continue.
Okay, apologies for this. Maybe I'll just continue. Okay, but you can still see the screen.
Yes, yes, we can see the screen.
Now how do I get back to the screen? Sorry, let me just stop sharing. Let's start again. So can you see the screen now?
Yes, we can. We can see the screen. Are you able to just the cursor, just take it below? On the right side, there is something like a screen, a small one. There is notes, comment, and then we have 4 boxes. Yeah, then go to the
Optimize
fourth.
sharing? No.
Yeah, but it's okay. We are able to read the notes, so it's okay. You can continue.
Yeah, sorry about that. It's always confuses me. Anyway, so I'm here to speak about public health in the digital age. Really focusing on understanding the relationship between digital lifestyles, non-communicable diseases, and mental wellness. By way of introduction, just as an outline, I'll have a brief introduction, and then which will focus on digital well-being, and then also something about non-communicable diseases, which are generally referred to as NCDs, looking at the burden and the risk, and then move on to just an overview of sedentary digitalism and NCDs, digital wellness, and then with a conclusion at the end. So by way of introduction, I'd first like to introduce the Non-Communicable Diseases Alliance Kenya. We are a national umbrella body of different organizations working in the area of non-communicable disease. These are organizations which are working on advocacy, prevention, control, as well as care and rehabilitation. And important for us to remember that all of us are at risk of NCDs. And in most cases, many of us are either living with an NCD or caring for people with NCDs. But it's important for us to remember that everyone is at risk. There's no one who's immune to NCDs. We have more than 60 members cutting across professional associations, patient-led groups, as well as local and international NGOs. We have a vision of NCD-free Kenya, and we work across the areas of advocacy, mainly working with people with lived experience of different non-communicable disease as the advocates. We're also involved in health system strengthening, where we work in partnership, we collaborate with the Ministry of Health and other partners working in the area of NCDs, and then research and knowledge management. So that's just a brief introduction to NCD Alliance Kenya. Just talking about just a small overview about digital awareness. As we are all aware, and I think everyone here is aware that the ubiquitous presence of technology and the effect that it's likely to have on your well-being. Digital well-being is how the internet and technology makes us feel. And then it's also important for us to remember the online impact on mental health, physical health, as well as emotional health. And even though technology is enabling us to do things better, it should not negatively affect our lives. So some of the negative online experiences which impact on our digital well-being, a lot of people, it's the issue of the self-image, issues of relationships, and even the view of the wider world as seen through some of the digital applications that we get involved with. Other factors which are going to influence our digital well-being is obviously there's a lot of digital drama which we are exposed to. There's the issue of the desire to fit in. Sometimes you come across distressing or unsafe content. And then there's the issue of the amount of time that we spend on the screen and how can we adopt a healthier balance between screen time and other active forms of living. Just to move on to introduce non-communicable diseases, essentially NCDs are responsible for about 74% of the deaths annually, which is about 41 million deaths globally. If you look at Africa, there's been a rapid population growth and urbanization, which has led to lifestyle changes, which has led to reduced physical activity, increased consumption of unhealthy foods, and other products which make us prone or more at risk of developing NCDs. We also need to remember in the continent, the socioeconomic disparities, which mainly affect people from the lower socioeconomic backgrounds, which often limit their access to nutritious, healthy food, as well as healthcare services. So this has a big role to play in the increase in NCDs in the continent. And essentially, these factors increase their susceptibility to diabetes and other related non-communicable diseases. Also, on the continent, we need to remember there's a coexistence of infectious diseases, for example, tuberculosis and HIV, as well as limited resources and access to healthcare. And some of these infectious diseases are also known to make us more susceptible to developing non-communicable disease. And then again, there's an aspect that we're discussing today in terms of the digital overload that many of us are exposed to. In terms of the NCD burden in Kenya, NCDs account for 43%, about 43% of the deaths in Kenya. And essentially more than 50% of hospital admissions are due to non-communicable diseases. It's also important for us to remember that NCDs are lifelong conditions, and because of this, they require lifelong management. And in our context, many have to cater for their NCDs out of pocket, and NCDs are known to reduce household income by about 30%. And they're also associated with about 23% reduction in household income relative to households which are affected by communicable diseases. So if you have an individual or you have a family member in your household who has a non-communicable disease, say diabetes or high blood pressure or even cancer, this is really going to reduce your household income. The pie chart shows you the distribution of non-communicable diseases, with cardiovascular accounting for about 33%. Then we have the different types of cancers, chronic respiratory conditions, diabetes, and then other NCDs. For example, sickle cell disease. Sickle cell disease is a non-communicable disease. We also have mental health under NCDs as well. So the next slide just shows you what are the risk factors. These are factors which make one more likely to develop a non-communicable disease. Essentially at the top, we have some of the main non-communicable diseases: cardiovascular disease, essentially diseases of the heart and the blood vessels, chronic respiratory diseases which affect your lung and respiratory system. We all know about cancer. We have diabetes, mental health and neurological conditions. Neurological conditions would include things like epilepsy, among others. So what are the risk factors which would make you more likely to develop a non-communicable disease? Unhealthy diets. These are diets which are high in sugars, fats and salt. The use of tobacco and also the use of nicotine. This makes you more prone to developing NCDs. The use of alcohol. I know this one was, initially they were talking about harmful use of alcohol, but it's now been shown that there's no level of alcohol which is beneficial to your health. Physical inactivity, which I believe is what we are discussing today, and air pollution. So essentially, looking at the different factors, we have the role of urbanization and globalization and other social cultural factors which are influencing our behaviors in terms of alcohol, tobacco consumption, unhealthy diets, physical inactivity, stress, and air pollution. And here we can also add the issue of digital health and digital digitalism. Then there are other factors. So these are the behavioral risk factors. There are other factors that you cannot really control, the aging, your age, and your family history. So there is a role that genetics play in your predisposition to developing NCDs, but the main factor is actually behavioral. So these are going to influence issues of physiological factors. For example, your overweight or obesity, causing these behavioral risk factors, and your family history and aging will influence these physiological factors so that you might develop overweight or obesity, increase in blood pressure, increase in blood sugar, increase in cholesterol. And then this is what is going to lead to conditions like cardiovascular diseases, for example, heart attack and stroke, or diabetes, cancer, and many other of the non-communicable diseases. So moving on to looking at digitalism and issues like alcohol, tobacco, and nicotine use. Some of the challenges we face is the fact that digital tools and online advertising and marketing techniques, where they promote the use of these agents, alcohol, tobacco, and nicotine, and these tend to be really promoted and targeted, especially at the youth and young adults. And at the moment, this kind of promotions or marketing techniques is unregulated. So you find that children are being exposed to all these promotions and basically being targeted by the alcohol, tobacco, and nicotine industry. And then online marketing and sales, which means that you have unrestricted access to the purchase or access to these commodities. And if you have if you're able to pay for them online, then you have them, you have unrestricted access. So basically, it's important for us to remember that these products, as I've mentioned, are risk factors for non-communicable diseases like diabetes, cancer, cardiovascular disease, chronic respiratory condition, and also mental health. So tobacco and nicotine products, especially the novel nicotine products and smokeless tobacco products, which are now being marketed as safe alternatives to tobacco. And this marketing is really targeted at the youth and children and young people by the way that these products are being presented at the moment. It's important for us to remember that nicotine is addictive, and also tobacco is really the entry point to other substances of abuse. If you look at the in Kenya, the NACADA report, the most recent one, talks about the initiation of tobacco use in children as young as 5 to 7 year olds. And then again, I've already mentioned the aspect of alcohol, that no amount of alcohol is beneficial to your health. Another factor which is also contributing to NCDs is the role of sleep. And this is critically important for children and adolescents. And essentially sleep is often overlooked as an NCD risk factor. It's important for us to remember that sleep is affected by and also affects non-communicable diseases. So basically, insufficient and or mistimed sleep is a risk factor for obesity and non-communicable diseases, for example, high blood pressure, which is hypertension, cardiovascular diseases, and type 2 diabetes. Essentially, if you're sleeping less than 6 hours on a routine basis, whereas the recommended sleep duration is between 7 to 8 hours, you're at risk of developing non-communicable diseases. The other issue we need to remember is the use of electronic devices, especially at night. And I know we are now having a nocturnal generation where they're working at night, they're online at night, and I guess they're sleeping during the day. So basically, important for us to remember that sleep is essential for mental as well as physical health. And the use of electronic devices at night is going to impact your sleep behavior. For example, sleep quality and deprivation. And the short wavelength light also suppresses melatonin secretion, which allows you to have the ideal awake sleep patterns. And then again, these electronic devices will increase stimulation, so both mentally, physically, and emotionally. So basically, this is displacing sleep. So instead of being asleep at night, you're now being overstimulated at night, and this is really impacting on your behavior. So you end up with irregular sleep-wake patterns, which obviously is not good for your health, especially your mental health. Now, moving on to mental health. As we mentioned at the beginning, some of the online apps and digital tools give one an unrealistic view of self and also of the world. There's also the aspect of cyberbullying and mental health. And really, it is now well known that mental illness the onset of mental illness is really at during adolescence and young adulthood. So the other thing we need to remember is the issue of suicide, which is one of the leading causes of death in the youth. And addictive screen time use has been linked to youth suicide risk. So basically, adolescents exhibiting high addictive use behavior with social media, mobile phones, or video games face roughly double the risk of suicidal behavior, as well as symptoms of anxiety, depression, aggression, or rule breaking. So this is something that we need to remember, especially for adolescents and for young people, and even for children, the dangers of being overexposed to digital tools, unrestricted use. The other issue is sedentary behavior. As we well know, where we're on the computer, we're on the phone, we're basically inactive, we're not physically active. It's important to remember that the body operates on a system of balances. So essentially, energy output should equal energy input from the food that we eat and everything else that we consume into our bodies should equal energy output. But if you're having excess energy input where you're not being physically active, so that in this case, your energy input is way in excess of your energy output, one is going to develop and become overweight, and this is going to lead to obesity. So basically, sedentary behavior is associated with pervasive use of screen and digital devices. And this is, as we've mentioned, impacts both your physical, emotional, as well as your mental health, and is a risk factor for obesity, diabetes, cardiovascular diseases, and certain types of cancers. Another issue with sedentary behavior is, as we mentioned, the issue of obesity. And really, obesity is fueled firstly by your sedentary behavior, as well as the types of food that we consume. Now, if you look at the kinds of foods which tend to be advertised on digital platforms, this is now a tool which is being used for marketing unhealthy foods. And these are foods, as I mentioned, which are high in sugars, fats, as well as salts. And especially for children, where they're marketing sugar-sweetened beverages and other really sugary foods. So unhealthy foods are those which are high in salt, sugars, and fats. And overconsumption of these types of foods is going to lead to a situation where you have more energy being, you're consuming more energy than you're really dispensing. And this is what is going to lead to overweight and obesity and put you at risk of developing conditions like diabetes, cardiovascular disease, certain types of cancers. If you look at the case of Kenya, there's an increasing prevalence of diet-related non-communicable diseases. If you look at women of reproductive age, about 45% are obese, whereas about 20% or 21% of adult men are also obese. If you look at the issue of diabetes, up to 7% of adult women are living with diabetes, and similar range, about 7% of adult men are also have diabetes. And this is related to the obesity epidemic. In terms of high blood pressure, about 27% of adult women have high blood pressure, and a similar percentage of men also have high blood pressure. And this has been related to the kinds of foods that we are eating, and this is what is referred to as some of the diet-related non-communicable diseases. So looking at NCD prevention, what do we need to do? So basically, non-communicable diseases, as we mentioned, are linked to certain systemic factors which shape your life. They're social factors, commercial and physical environments. So basically, the social, commercial, and physical environment, these are likely to limit your ability to make healthy choices. Healthy choices in terms of the food that you consume, in terms of alcohol use, in terms of tobacco and nicotine use, and also in terms of physical activity. So basically, these social and economic inequities fuel the burden of non-communicable diseases, and some of these issues which are fueling the burden of NCDs are issues of poverty, gender inequality, poor access to healthcare, poor urban planning, where, for example, these days we're living in high rises, there are no spaces to be physically active, children can't walk to school because of insecurity. We even don't have walkways along the roads which are free from borders or matatus. So essentially, it is difficult to be physically active, especially in Nairobi at the moment. And then again, there are the commercial determinants, the food systems, and the marketing of these products. So basically, for non-communicable disease prevention, we need to create environments that support health-promoting behaviors, and also those which limit exposure to the risk factors. So basically what we have been looking at is a pervasive use of screen and digital devices, your smartphones and computers and everything else, are influencing social, commercial, and physical environments, which limits our ability to make healthy choices. For example, physical activity, eating healthy, nutritious foods, which include vegetables and fruits, rather than fast foods, which are readily available and marketed directly to us. And this is what fueling sedentary lifestyles. The use of screen and digital devices is fueling sedentary lifestyles with decreased physical activity and movement. And this is impacting on physical, emotional, as well as mental health, and is a risk factor for obesity, diabetes, cardiovascular disease, and other types of cancer. So just important for us to realize that these digital platforms are more than commercial tools. They are a public health risk, and we do need to regulate the use of these devices. So basically, in conclusion, we need to promote awareness of the hidden health risks of digitalism for NCD prevention. We need to be mindful, and intentional, use mindful and intentional approaches to digital use so that we have healthy digital use. And this would include in terms things like limiting screen time, especially for our children and adolescents, and especially at night. We also need to regulate online promotions, the marketing and sale of alcohol, tobacco, nicotine, and healthy foods, especially to children and adults. I should have also mentioned here that we also need to advocate for spaces where we can be physically active, walkways and open spaces, and also see how we can stand up against the current trend in Nairobi, and I think in many parts of Kenya, where we're now just building high rises beacon to beacon with absolutely no space for children to play safely. And a lot of times the children are staying indoors, watching TV, having access to phones and playing computer games. So in terms of physical activity, it's practically zero in many of the estates in our country. And then again, the issues of insecurity, which will influence how you can actually access spaces for physical activity. So we do need policies to promote digital wellness so that we can have a healthy relationship with digital technology. We also need spaces for physical activity, which is critical to improve health, mental well-being, productivity, as well as quality of life. So even as we embrace the digital age, let us make sure we're not throwing out the baby with the bathwater, but having spaces to be physically active and also embracing digital wellness for a healthy relationship with digital technology without compromising our health, without compromising the quality of our lives. So on that note, I'd just like to say thank you very much, and I'm happy to take any questions and also happy to listen to the rest of the afternoon. Thank you very much.
Thank you so much. Thank you so much, Dr. Ali. That was really informative, and I really appreciate that. Let's give Dr. Ali her flowers. I can see Dr. Ali received those flowers. That was really educative, and it is so clear. This is not NCD Alliance responsibility. This is gonna be each and every one of us responsibility. What do we really need to do so that we can help our generation, we can help ourselves, we can help our mothers, and we can help our fathers. So we really need to work it so very fast, because if we don't do it, if we don't change our sedentary behavior and also pervasive use of pervasive use of screens, will end up struggling to combat and overcome some of the NCDs rise that we have currently. So wellness starts with us. So let's create wellness in digital space. So Dr. I would like to ask you to not to leave because I know we have so many people who may be having questions to react to the presentation, wonderful presentation that you've just done. So if there is any question now, you can raise your hands. And if there is no question, you are still digesting, Dr. will still hang around. Okay, I can see Brima Rogers is having a question. I'll take two. I'll also take Yona. So Yona, okay, so I'll start with Brima. Brima, kindly unmute yourself and feel free to ask question, after which we'll go straight to the next keynote address. to start up our first panel discussion. Over to you, Brema.
Yeah, good morning from Sierra Leone. I am Brema from a community advocacy for movement and progress Sierra Leone. It's not a question, it's just a concern regarding the presentation that she just did. I really want to know at continental level, and can you hear me clearly?
Yes, go ahead.
And at maybe country level, what will we do to popularize the same things that we are doing here at national level to ensure that we popularize the NCD and also do a lot of mobilization, and so we do a lot of policy advocacy at national level? What provision do we think we'll put in place to do that one? Thank you so much.
Okay, thank you so much. Dr. I hope you're noting that. Then I'll go to Yona.
Yes.
And yeah, you are audible. Go ahead.
Yeah. Okay. Thank you very much. My name is Dr. Sraj. I'm from Ethiopia, East Action First Executive Director. I joined this program because it's very important a program. Thank you for organizing this valuable symposium. It provides an excellent opportunity to learn and share experience and build partnership to advance in digital education. So since this program is very important, I would like to ask you, how we can expand this program and how we can partner, and how is it individual-based membership or an organization-based membership, or it is localized only at the national level?
Okay, I think that belongs to me. That's not for Dr. Anyway, so I think it's open for individuals and also institutions. We'll share more discussion. We have your email. So after this, we'll be able to share more information for membership and also on how we plan to localize it within Ethiopia and some other countries. So Dr. you'll go for the first question. Then I think our time is going so that we start up our session.
Yeah, so thank you very much, Prima, for your question. If I understood it right, you are talking about mobilizing for non-communicable diseases and how we can get to the continental level. Okay, maybe just to talk about what we are doing in Kenya. As I mentioned, we do work with the Ministry of Health, and there are various technical working groups which are focusing on different aspects, for example, on healthy food, alcohol, and all the rest. There's also a mental health technical working group, which is where this may fit. I'm not very sure. But I know at the moment we haven't really started tackling the aspect of digital health. It's not an issue which, at the moment, from what I have seen, is on the radar for the Ministry of Health and for other policymakers. But it's a conversation that needs to be had even in your own countries. Start the conversation with the Ministry of Health, the Ministry of Education, the relevant ministries, just for them to understand, yes, digital tools are here, they are helpful, they're useful, but they should not be taking over our lives such that we are no longer physically active. And even at an individual level, just try and restrict the amount of time you spend on the screen. Have adequate time to do other things, to go for a walk or just to go and chat with your friends. So it's going to be a difficult one, I think, probably more difficult than fast food and alcohol and tobacco, because our digital tools have become part of our lives. And again, we'll be fighting against the big industries, which we have done with alcohol and tobacco, and now we're doing with our with unhealthy diets. But it's something that by creating awareness, especially amongst families, and for parents to understand that you may not have time always for your children, or they may not be able to play outside. But using the TV or the phone and other digital tools as a babysitter is not really the way to go. We may be restricted, but let's look for alternative things to do. Maybe reading or playing a game indoors or something like that. But now we're going to have kids who are hooked onto digital tools. And many kids will cry if they don't have access to a phone. So I don't know, it's going to be a difficult one. But I think if we can create awareness in the community of the dangers of the pervasiveness of these digital tools, and the need to be physically active and to do other things rather than spending time on the screen, I believe we'll be able to at least start making headways. Thank you. Sorry, I may not have answered very well, but that's what I think we need at least to start doing. Thank you very much.
Thank you, Dr. I believe that was helpful. Yeah, charity begins at home. Let's start having this conversation at local level so that we scale up this continental. That was very important. Ladies and gentlemen, at this point of time, allow me to introduce someone before he comes up. There is something that really came into my mind. We were supposed to go for break, but again, allow him to do his keynote address. Then we can go for a break. Or can we just go for a 3-minute break? Then we allow him to do his keynote address. Let me see thumbs up. Should we go for a break? Okay.
Yeah, we can.
Okay, so let's go for 3 minutes break. Then we come back for another keynote address. Then we open up for the panel discussion. Ladies and gentlemen, it's time to take 3 minutes. Please, I don't want to see you on the screen. I will want to see you walking, going for a glass of water, then stretching a little bit. Thank you.
Hands aligned for a brighter light, connecting hearts through day and night. In schools we plant the seeds of dreams, where knowledge flows like endless streams. Building bridges, moving strong, in every home where we belong. Workspaces hum with unity. Digital wellness sets us free. The tablets glow, a guiding spark from tiny hands. We leave a mark, impaling minds to rise and fly. Together we'll touch the sky. Hands aligned for a brighter light, connecting hearts through day and night. In schools we plant the seeds of dreams, where knowledge flows like endless streams. Hands aligned.
Okay, I think our 3 minutes are over. Right. Okay, I hope we are all back. Let's see thumbs up if you are there. I don't want to be alone in this. Anyway, ladies and gentlemen, at this time, kindly allow me to welcome someone who is really fighting so much by ensuring that there is inclusivity within every sector, and also we respect persons blessed differently in every angle, and even when we are stakeholders doing and coming up with solutions, they really need to consider having everything well undersigned and also inclusive to the person blessed differently. And with AI coming in, we've seen a lot of technology coming up for to help ease the movement, and also to help ease the hearing and also to help even help those who cannot see clearly to be able to get their vision, or enable them to see things perfectly well. But again, with technology, we have irritations, we have some other aspects that are really challenging to the persons who are blessed differently. I don't want to go deep into it, and I'll welcome John Otieno, and John Otieno, after John Otieno, our moderator with Valentine will take charge of the process. So, John Otieno, if you're there, kindly unmute yourself, and we'll want to hear your voice. Karibu sana.
Thank you, everyone. Good morning, good afternoon. I hope I'm audible enough.
Yes, you are.
Okay, thank you so much. So I would like to start by thanking everyone for organizing this a wonderful webinar on digital wellness. My name is John Otieno Ngindo. I work with the National Council for Persons with Disability. I'm in the program department. I'm directly involved in economic empowerment of persons with disability and education scholarship. So when I got this invitation, I was at a workshop. Currently, I'm still at the workshop in Naivasha, Nairobi, Kenya. And I said that I would love to maybe say a word or two to ensure that there is inclusivity in whatever is being discussed here. So as we have heard from various speakers, the world is undergoing a digital transformation, and it is really impacting our lives. Nearly all sectors are embracing technology, right from health sector, education sector, governance, employment, how we live, how we communicate. So the world is really evolving, and we are really embracing technology. As you all know, the AI thing has come in, and the fears are that it may even take some jobs that we are doing on daily basis. So on this webinar, I would like maybe to highlight some few things that I've noted. One, National Council for Persons with Disability is a state parastatal that champions for the right of persons with disability. And the right language that maybe we should use when referring to PWDs is person with disability, not person living with disability or person able differently. It is just person with disability. So when it comes to technology, technology always comes with a lot of benefits and challenges. So when I got an invitation from my friend Collins, I was wondering of maybe what I should maybe talk about today. And maybe I sat down and I wanted to talk about the challenges that PWDs experience, especially the PWDs, person with disabilities who are visually impaired. There are those that are physically handicapped. There are those that have low vision, like person with albinism. We normally refer to them as PWS. There are those with who are autistic. There are so many categories of PWDs. So sometimes I was when I was making this presentation, I sat down and maybe thought about myself when I'm using my gadgets, my laptop, my phone. I remember when I'm in the office, I have a desktop. And sometimes you find yourself so much stuck into your phone without realizing how much time you've taken there. So I was wondering, I am a person who is not disabled. And you realize sometimes you spend a lot of time in the internet that when you finish maybe doing what you're doing, you realize you've taken a lot of time. You are physically exhausted. Maybe if you go to a dark room, you just see, I don't know how to call them. You are not able to see clearly. It means you have a longer screen time that has maybe interfered with your visual. So I was maybe putting into context the aspect of a person. Maybe you imagine somebody who is amputated, and maybe they are in the YouTube, they are watching. Maybe they are learning something from the YouTube, and there is an advert. When there's an advert, there's somewhere up down there that normally bring to continue watching. You need to press this one to skip it. So how long will this person take? Somebody who is amputated both hands to press at that button of skipping, so that he can continue, or she can continue watching such kind of learning materials or whatever they are doing in the YouTube or other social media platform. And that make me realize that maybe there's a need to do something when designing these platforms, so that they might be inclusive, to ensure that PWDs are also taken care of. So some few years ago, government came up with austerity measures to help them curb maybe high cost, the corruption and whatever. So these austerity measures was giving direction to government parastatals, MDAs, institutions to embrace paperless. When we embrace paperless, it means maybe when you go to work, you are given a laptop, you are given a tablet, you are given a desktop to work. How are these impacting PWDs? Does government take into consideration when they are giving this directive, the PWDs? Because, for example, if you are a person with albinism, you have a very low vision. If you are given a laptop, you need to have a magnifying glass. You need to have large print so that you can able to do something. Maybe if you are an accountant, maybe you are in a program department, you have to do an email. You need to have a glass, or maybe you need to have a design whereby your desktop or whatever gadget you are working with as a large print, so that you can able to work. So what am I trying to say? I'm trying to say when we are designing this platform, social media platform, we need to take into consideration persons with disability, their well-being, so that they don't take a lot of time in the screen doing something that maybe as a person with disability can take a very shorter time to do. So another thing that I wanted to talk about is the opportunities that come with these social media platforms. So one, just a moment. Sorry, I wanted to talk about what are the consideration that should be considered when designing this platform. So one, I felt that when designing this platform, we need to involve PWDs from the beginning. They should not just be involved like an afterthought. Like you've designed a platform is now when you are trying to incorporate features that can enable PWDs to work efficiently with this platform. Another thing that I thought maybe it's important to mention, there is a need to include, for example, a person who is visually impaired. They will only depend on the sound. So when you are designing this platform, like we are right now, we are in Zoom meeting, I think there is a need to include the sound aspect of it, the video aspect, text, maybe for those who are, how do we call it, hearing impaired, they need to have text, they need to have sign language interpreters. Another thing that we need to consider is the compatibility of this platform. For example, a person who is hearing impaired will require assistive. There are people who are we call them. They're not able to hear well, but they're partially impaired. So they need hearing aids to enable them to listen to us, to communicate with us. So we need to ensure this system are compatible with assistive technology. Then finally, we need to personalize these websites to ensure that various persons with disability are able to use this platform effectively and are able to gain a lot of benefits, and they are not affected by physical inactivity due to maybe longer screen time of doing something that maybe they could have done if this could have done very fast if if these features were included in this platform. Otherwise, I want to thank you and to thank everyone for participating in this program. I'm currently in a workshop and I'm supposed to do another presentation at around 3:30. So I don't know if maybe there is a question that maybe they will need me to answer. I'm open for it.
Thank you so much, Mr. John Otieno. I really appreciate you, and thank you for even honoring our call. Ladies and gentlemen, if there is anybody with a question, kindly raise your hand. But at this time, I'll be able to welcome now officially the moderator for today. She's someone that is really very interested, and they're really working so hard towards AI space, ethics space. And she's really doing amazing job in terms of bridging the gap and also sharing insights and information and knowledge across the globe. So Valentine, if you are there, allow me to welcome you to Tech Chat.
Okay, thanks, Collins. I believe I am audible. And
Yes, you
thank
are.
you so much, John Otieno, for those amazing insights, and especially what the government is doing towards inclusivity for people with disabilities. That's really great to hear. And perhaps if there's a question for you, I saw there was a question from Lizzie Otaya. Her hand was up. I'm not sure if it's still up or if Liz, do you have a question for John?
Yeah, this
So,
is thanks.
okay.
Yeah, let me just shoot it out right there because I know he's about to log off. John, I hear you, and let's be honest. Now that we're talking about integration and transitioning for Global Fund and other partners and donor funding dwindling, and the official development assistance going a little bit lower in 2027. Persons with disabilities are always, and forgive me for saying this, are always going to be an afterthought. And we tried to push that agenda that it should not be that way. But now, because there are no funds, they're still going to be an afterthought. So I just wanted to hear from you. Do you think this is more of a policy and legality aspect where a lot of projects are being run and they're not actually being held accountable um, from the get-go to include persons with disabilities in everything that they do, and they end up being an afterthought? So I wanted to know, for us to fix this, do you think it's a legality issue, the policies are missing, or does just that mean that we're not human enough to think of persons with disabilities as receivers and beneficiaries from the get-go?
Thank you, Liz, for that question. It's a good question, and I think you've reminded me of something that I forgot to mention. Person with that always person with disability have always been considered. They have always been taken as an afterthought. So recently, I think around 2025, Kenyan government, with the help of National Council for Persons with Disability, enacted a policy called Person with Disability Act 2025. So, Person with Disability Act 2025, one of the major impact that it is going to have, it is going to transit National Council from service delivery to enforcer state parastatal. It means we are going to stop providing services that we are providing. It will be gradual, and we will start enforcing the laws that are always there, but the implementation has always been a challenge. So if you look at, I think it is section, I think it is section 26 of the PWD Act 2025 that talks about, it talks about right to information and communication technology. So this policy talks about, for example, in the context of digital wellness, it talks about information, the format in which information are shared should be appropriate for all for different type of disabilities. The policy says that, just a moment. The policy says that access is not about ramp or buildings. When you tell people about access to information, access to transport system, access to building, people see it as making a place being very accessible. But I think this policy is going to be the next frontier in ensuring that Kenyans view accessibility not as a ramp or a building, but as a place where a person with disability is able to access information, promote their health and well-being, reduce burnout, and all those kind of non-communicable diseases. So this policy is being implemented in phases, and I think recently you saw there was signing of sign language. The law was passed in parliament and the president assented to it. Sign language interpretation law that will ensure that all government institutions, parastatals, and even some private sectors, there is a sign language interpreter. So that when a person with not visually, but hearing impaired come to the office to seek maybe assistance, they are able to get assistance, they are able to communicate and get the right information. Thank you, Liz.
Oh, amazing. Thank you so much for that, John, for enlightening us even on that policy you've mentioned, Section 26, and uh, and also on that Kenya Sign Language interpretation law. I believe if this is implemented, especially within the parastatals, within the different government agencies, that will have an effect and trickle down to the private sector and even to other businesses within Kenya. So thank you for that, John. If you're able to stay with us, we welcome you until you have to leave. So thank you so much for that. We'll just get right into the panel. So as Collins has mentioned, I'm Valentine Kamau. I'm the founder of a podcast called AI Healthbeat Africa, where I spotlight founders and other system builders within the AI and digital technology space. I have dropped the link in the chat box and also my LinkedIn. We can connect there. Feel free to reach out and continue the interaction beyond this. So I will just get right into it. We have heard how John has set the stage for us. He has reminded us that AI is rapidly reshaping our societies. Our responsibility extends beyond developing technologies. We must ensure these technologies are safe and ethical and designed to protect human dignity, more so for PWDs. So the panel I'm about to introduce will build on those reflections. AI is transforming healthcare, education, employment, and many aspects of our daily lives. For PWDs, AI has a potential to improve accessibility, independence, and participation like never before. But that future is not automatic, as even John has highlighted. If AI systems are designed without accessibility, inclusion, and ethics at their core, they risk reinforcing existing inequalities and creating new barriers for the very people they should empower. Today's conversation, there one central question: how do we ensure AI becomes a bridge to inclusion rather than another source of exclusion? And to explore this question and many more insights, I'm joined by three panelists, and I will just mention their names, and as they speak, they will tell us a bit more about themselves. So I'm joined by Dr. Damian Eke. He's the assistant professor at University of Nottingham. He's also the founder of Africa Brain Data Networks. We'll also be joined by Lilian Mutegi, who is the founder of Tech Education. This is an EdTech and inclusive learning specialist platform. I'm also joined by Agnes Wangoi, who is a PWD advocate and a digital wellness strategist. I hope all my panelists here, Collins, and I will just call up Damian for a brief introduction. So each of you can have a brief introduction, and then I will get right into questions after you just introduce yourself. Then I will get into your questions. Over to you, Dr. Damian.
No, I think you did a good job of introducing me. Damien Eke, Assistant Professor, School of Computer Science, University of Nottingham, and also the founder and director of African Brain Data Network. My research and expertise sits at the intersection of data, society, and emerging technologies, including AI and neurotechnology.
Amazing, thanks for that. We can go over to Lilian Mutegi.
Hello, good morning, good afternoon. Unfortunately, I'm not able to switch on my camera, technical challenges, but I'm Lilian. I'm based in Nairobi, Kenya. I am an innovator. Companies called Uptake Education. We develop and distribute accessible learning content aligned to the curriculum for persons or rather learners with disabilities in Kenya. And I'm happy to be part of this conversation.
Thanks, Lilian. And over to you, Agnes Wangoi.
Good afternoon, good evening. My name is Agnes. As you have heard, I'm an entrepreneur and also a digital wellness advocate, and also I'm a person with disability who is having physical disability. I'm very glad to be among the panelists and look forward to also engaging on more topics according to digital wellness. Thank you.
Thank you for that, Agnes. Thank you, Lillian, and thank you, Damian. And now, the first, how we'll first tackle this topic, we will want to understand the challenge. What is the challenge exactly that we are looking at? And so, for Damian, AI systems are increasingly relying on behavioral data. This means from our searches that we do on our phones and the purchases to our health and social media activity. And so, how is AI currently harvesting this data from African consumers, and what specific risk does it pose to young people, and more so to the topic now of PWDs? How is that based on your research and everything you do?
Okay, thank you very much. I think I will take a step back before we get to data. Let's talk about the technology, AI. I think I don't want to go into also the contested definitions of AI. But what I will focus on is this. AI it's a group of technologies because there's no one single thing called AI. There are groups of technologies that are built with values in them, right? They are not neutral technologies. They're not neutral artifacts. They are value-laden artifacts. So they are built with the values of those who are building them in mind. Values such as trust, values such as responsibility, values such as transparency, accountability, robustness, usability. So these are values integrated or embedded into the design, the development, and deployment of AI systems. Imagine that possibly 80 to 90 to possibly 95% of these AI systems are being built in the global north, right? And by people living and working in the global north, and then being imported or exported to Africa. That means majority of the values embedded in these systems are not African values. They do not represent our realities or expectations in them, right? So what we need is now to develop systems that align well with our realities and values. The reason why I'm saying this is this. The values are not just embedded through data. They are also embedded through the people, the experts that are building the system. They are also embedded through the algorithms involved in AI systems. So whoever controls the data, whoever has the data, whoever has the algorithm, and whoever trains his own experts to develop these systems controls how AI behaves and who benefits from the AI systems. For us in Africa, we are still working towards developing some of these systems to align to our realities. That means the AI systems that we are using, that were developed outside of our region, do not speak to our language, do not speak to our culture. I give you an instance. I think majority of those on on the call are Kenyans. If you live in the Rift Valley of Kenya, or possibly if you're Kipsigi, right, right, or if you speak Kipsigi, you know this is called ISIT. ISIT is not malaria, right? But AI models oftentimes pick it up as malaria. If you describe your symptoms, it can pick it up as malaria. So that means you'll be prescribed malaria medications, wrong treatment, wrong diagnosis. It's simply because the AI system does not speak to the values and realities of that region, of that language, right? So that means the use of that system in that region can misdiagnose or possibly give wrong treatment to people. That is the problem that we're facing here, the challenge that we're facing here. And it's not just a problem of data. it is also the problem of the fundamental epistemology that shaped the AI system, right? It's the algorithm that is embedded in the AI system also. It's not just the data, right? So what we need are systems, AI systems that speak to our language, that speak to our culture, that speak to our epistemologies, that speak to our expectations and realities, so that they can provide equal or relevant benefit to our society. Coming back to data, right? There are loads and loads of AI systems now being built within Africa and outside of Africa being marketed to us. Loads of these systems collect data from us. The fine print of informed consent is always there, right? I don't know how many people in the room read the privacy statements before they click, yes, I agree, right? And they collect these data sets. They do not store it within our region. They do not store it within your system. They have access to this data, and they are building systems or improving their systems based on these data without equal benefits to our society. There is that problem of data colonialism there, right? We call it data colonialism, the coloniality in data, where we're only an extractive source of data for these big tech companies, and they exploit that data for economic benefits for their own without sharing that benefit with the communities that they collect data from. That is happening. And a fundamental reflection of this is the possibly revised USID contracts or agreements being done with governments now. It's not just about these apps, but also foreign governments are interested in our data, not only for AI, but for other reasons. When Trump, I'm going to call his name, when Trump stopped the USID, right? Slightly over a year ago, everybody thought it was over. No, nothing was happening. But recently, earlier in this year, we discovered that what the US did was started negotiating with African governments for this funding. If you still want access to this USID, give us access to your health data. If you don't give us access to your health data, you will not get this funding, right? So our health data has become a bargaining chip for the US for this USID funding. There is a real reason why they are doing it, because it is valuable, right? And one would ask, what country in Africa will sign this agreement with them? Some news for the Kenyans in the room. Kenya was one of the first countries to actually sign the agreement, right? So your health data, the US government will have access to it because they're giving peanuts in terms of funding for USID. So there are real reasons for that. The reason is because of the value of the data, and also another reason is because they want to exploit the data for their own benefit. They will tell you that they are monitoring tropical diseases so that they don't get Ebola but that's not true, but because there is value to that. What we need is local capacity, local expertise to develop our own systems with our own data without exporting this data to countries or companies in the global north. Is that possible as everything is set up at the moment? Possibly not, because we do not have the compute power or the infrastructure or architecture to actually do that for Africa. We will still continue to depend on cloud systems built by these big tech companies in Silicon Valley. But also, what we need to do is to develop responsible innovation or frameworks or approaches that can help us to exploit or possibly prevent these exploitations, right? And maybe I will stop here and talk about the 5C framework that my team has developed for this later on.
Okay, those insights are quite insightful, actually. And you know what you've mentioned about the AI systems being developed in the global north, and then we get them over here, 80 to 90%. That's a really staggering statistic, and it's the reality. And that's why such discussions are very important. So as you've mentioned, health data has become the bargaining chip, and we all know what is happening in majority of the African countries. So it's up to us to maintain our sovereignty, especially in terms of health data. So thanks for those insights, Damian. So understanding the risk is only one part of the equation, and Damian has alluded to part of this risk. The next challenge is ensuring that these technologies are intentionally designed to include everyone. Now, Lillian Mutegi, the founder of Uptide, has worked intensively on designing digital solutions and more so for people with disabilities. And so, Lillian, over here, if you can just tell us, what does inclusive digital wellness look like for users with, for example, mobility, visual and hearing impairments, and how can AI help improve this and not create? Over to you, Lillian.
Thank you so much. And I'm so interested also to learn from my fellow panelists. That's quite something. I think I'll just, ride on what he said on the localization issue, that being obviously a major issue. But now when it comes to EdTech, which is education technology, I think for most of us, either as innovators or other parts, people in the ecosystem, I think the major thing we are prioritizing is access. We just want to push through, tech products. And while that may be the best, maybe approach, one of the things that we are failing to do and neglecting actually now from a learning experience is the experience, something we call the learning science. So for instance, when you create like a platform, yourself, you're so happy, you and your tech team to give it a thumbs up, it's techy, it's good, but we are neglecting the experience of the learner, the user journey. We are doing a lot of tech overload in terms of, the systems that we are building. We are not really putting ourselves in the lived experience. For my case, I'll talk about the learners with disabilities or either persons with disabilities. What we are doing, and I think we've had a couple of engagements and sessions to discuss this, is to essentially stop building for them and to rather build with them. So co-creation really at this point is highly recommended so that now your tech skills, whatever you can be able to now marry it with the lived experience of either these learners with disabilities or persons with disabilities. So when it comes now to the wellness gap, that is the major challenge that we've been able to, experience and maybe address at this point. And I would recommend even for the rest of us maybe to have that in mind, to do a lot of testing. We are building products with a lot of assumptions. We are building products for people, not really necessarily putting yourself in that lead experience. So you need to test the assumptions, with the ecosystems that we have, even in this forum, for instance. And then also the most important one that I'm gonna maybe touch on, like I said, localization, is the lack of culturally relevant, either for us now, content. For instance, I'll give you like a quick example. When we started the content creation a couple of years back, and in one of the subjects would say, look at these kiwi, as part of the fruits. We were telling learners to name fruits, and we mentioned kiwi, and we had a very beautiful drawing, complete with the alternative text descriptions for for learners with visual impairments. But one of the testers told us, what is kiwi? A learner in Mandera, you're asking them kiwi. Even in my own county, the Rakanidi County, what is kiwi? They have never seen kiwi. Why not use a banana, a mango, something that is quite locally relevant in terms of even the content that you're developing? And now when you go now even into detail with the content, is also there's a lot of digital fatigue going on, especially for learners in the neurodivergent space. Like, we just want to make sure that one content, I know we are working with universal design for learning, whereby whatever content you design can be consumed by all learners, but also it's for you, even as you're designing this, to make sure that the intended user, especially the learners in the neurodivergent space, are able to consume this data. So, you take care of, things to do with the sensory sensitivities, can they adjust the light, the sound, the pacing, the font, and things like that. So I think for me, when I think of, the wellness gap, I'm thinking about from the point of creation, even before you start developing, you have all these things, well displayed so that you're not just iterating while it's, already done. It's now pre-development, not post-development. I think that's what I would say at that point here.
Okay, thank you for that, Lillian. You've talked about prioritizing access and also about the learning science that you're using to develop the solution. We shouldn't build all these innovators building for that space shouldn't build with assumptions. I like your example of the kiwi fruit because when that fruit, even the price is quite restrictive, even for anyone, even in Nairobi and any other surrounding counties, and even I believe in other African countries, that price is already out of reach for most people. So I like the example and using very easily available fruits, oranges. So thank you for that. And so now, as we've heard from Lillian and also from Damian, ultimately, no matter how well a technology is designed, what matters most is how people experience it in everyday life. And now, our next panelist, who is Agnes Wangoi, brings expertise in digital wellness and also has lived experience. So, Agnes, you
Yes? Yes? I can't hear you.
I think Valentine is having a network problem. Agnes, you can just start up. Then she can
Okay, what's the question? I didn't get to hear what she said.
The question was on the challenges that the person with disability face.
Digital wellness, yeah. As a person with disability, there are so many challenges that we encounter while using the digital environment. As for myself and some of my colleagues, we find that some websites, accessibility and usability barriers that we often find. You find for a person who is blind, they are not able to use some website because they do not support screen readers for blind users. Show problems, and you find that there is no voice over. Forced to use the website. So for the blind, they get challenges for using the websites of the digital environment. Even for mostly for the deaf users, this is something that we discussed with some of my colleagues. Also, they're sharing the challenges that they get through the using of the internet. The lack of captioning in some websites. The information that is there for ID visual, there's no captioning that is there. And for the deaf hearing, they say that the visual text is not visible. So it is very disadvantageous for both the blind and for the low. For a person with physical disability, the challenges that we mostly encounter is where the one required to use a mouse and a person does not have a hand or the part of the hand is not visible. It's so difficult to use the websites. And also people with cognitive disability find it difficult because of conflicting layouts and instructions that are usually in the websites or in the softwares. Another challenges that we encountered as person with disability is a lack of assistive technology. These are some of challenges that have been discussed by some of fellow colleagues, and also I can point in some few. For example, assistive technologies are supposed to help people, person with disability, to use the digital devices independently. So find some softwares or these tools are expensive or difficult to access for person with disabilities, and especially those for low income areas further, they don't able to access these devices that are come with those tools that are able to assist them. Also, I find the Like like now there is World Cup going on. The person with disability wants to see something or program in television. You find there's no subtitles, there's no language, there's no audio description of what's happening in the television. There is no commentary, there's no sign language interpretation. So these types of lack of the active technologies makes a person with disability feel left out with what is happening around the environment. For example, also can say screen readers for visually impaired users, hearing aids and captioning tools for people with hearing impairments, especially during meetings like this one. If there was a person with disability that is in this meeting among us, I can't see any sign language interpretation. So that is one of the things that person with disability feel like they're being left behind. Without this technology, makes a person with disability feel not be able to participate fully in the digital world. Some other challenges I can say is low awareness of accessibility features. Those persons with disability who are in the low income areas or especially in the rural areas, some of them are not aware of the devices or assistive technology that are available on the smartphones. They are not able to use or maximize them in their full potential that they can be able to help them in their livelihood. They're like, for example, text magnifiers for enlarging text that make for someone who is low visually to be able to read and see the text correctly. This because they can be able to reduce the eye strain and improve reading of access of books. They don't know about the screen readers that can read content aloud, that is for voice input. So this can help person with visual impairments or blindness be able to read the digital text aloud. They are not aware of the voice commands that allows hands-free operation, live captions. So many smartphones and computers and tablets that have these features, and people are not aware. For example, I can give an example how Safaricom is helping a person with disability by incorporating the voice response, where most people are long before they came about. You should ask a person to help you deposit or withdraw money from your account because you're unable to see. But that person can be able to scam you of money because you're not able to see the balance in your account. But the Safaricom introduced a voice response where the person with disability who is visually impaired is able to withdraw and deposit the money and be able to know the exact amount that is in the phone. So these are some of the features that are available, but because of lack of awareness, many people don't use it maximally. There is also that was talked about digital fatigue in the first session by Catherine, I think. There is digital fatigue and overstimulation, especially for people that are like, let's say, sensory or autism or learning disability. They are often unable to keep concentration or keep time, or maybe concentrate while using or to process the digital information. So those are kind of challenges that people who have low IQ, let's say, to put into terms, or mental low response, and able to be able to keep attention while using the digital environment. Another challenge that I came across are online scams or exploitation. A person with disability is targets of scams, and sometimes it's hard to identify the fake messages of fraudulent websites or online scams. These they can be targeted through maybe fake job offers, fraudulent financial schemes, identity theft, misleading social messages. That way, sometimes a person with disability, even a normal person, can fall into online exploitation or scams, not only a person with disability. And there is also cyberbullying or social isolation, where a person with disability can feel discriminated, or bullied online, where through it be insults, harassment, or social media. Sometimes feel exclusion from online groups and discussions. These are some of the challenges that I saw that came across through digital wellness. And there's also economic and social barriers, where there's digital participation often requires devices, internet, and assistive technology, which is very expensive because sometimes the 5% disability is not able to cater for the bundles that are required to be able to use this website or softwares. So because of the economic barriers, sometimes feel that they'll be able to be left out and they cannot be able to afford some smartphone or a laptop to be able to be included into the economic and social area. There is also gender disability. You can say there is a sometimes family There are some families that exclude person with disability. They can say that you are not allowed to use a phone. That is discrimination. Your family feels that you are that is being stigmatized by your family or the culture. The person with disability is not supposed to use technology. You're not supposed to use a computer. You're not supposed to use laptops or anything. So you feel discriminated against by either by society or by the culture around you. You can speak of many
Okay, thank
challenges, but those are the kind of few I can
mm,
go to say for now. Thank you so much.
okay. Thank you, Agnes, for highlighting those challenges. And I'm sure Collins is listening in, and I'm sure next time we have such a session, there will be some sign language interpretation. And I also like, especially, we are all watching the World Cup, even if sometimes it's at very odd hours for us in Africa. So that's actually a key highlight. Everyone enjoys watching a game of football. So there really should be inclusivity over there. I also like what you have highlighted, like what Safaricom is doing with the voice responses to enable people who are even visually impaired to withdraw and deposit money. So that's financial inclusion. So thank you for highlighting the various challenges. I'm sure as we go along to your next question, can also talk more about that. And now we'll go into something about designing responsible and inclusive AI. So from what the speakers have said, we've had why inclusion matters, especially what Agnes has said, and some of the challenges that remain. Now we'll shift our attention on how to build AI systems that are responsible, inclusive, and centered on the people that we're focusing on. Now I'll go to Damian. Now, as we know, African countries are now beginning to develop different AI strategies and regulations. As of the last time I checked, it's about 16 to 18 countries that now have AI strategies. So I know you alluded to ethical principles, and perhaps this is where you bring in the 5 Cs that you are talking about. So what ethical principles should guide AI governance in education and healthcare so that innovation remains both responsible and inclusive? Over to you, Damien.
No, thank you very much. And I very much love what Agnes was mentioning earlier. She listed a number of challenges, a number of elements of discrimination or possibly exclusion of people living with disabilities. That has a concept to it. The name of the concept is exclusion by design. So these are people excluded by design of the technology. They are excluded from using this technology or possibly easily accessing the technology. And that is not the only element of exclusion by design, right? If the example I gave earlier in terms of the Kipsigis language, if I don't know whether I'm pronouncing it possibly correctly, is also exclusion by design. So people are also excluded by design because their languages are not integrated into AI models or these design models that we have at the moment. So that is happening to us as Africans. It's happening to us as also subsets of the society, like people living with people living with disabilities. But another thing that is happening with these AI systems is the coloniality problem, right? People who have already listened to me before will hear me mentioning this often and on. There is the element of coloniality that is shaping the AI narrative, the AI ecosystem at the moment. What are we doing as Africans to address these problems? Within Europe and possibly some parts of North America, there is a responsible innovation framework, or responsible innovation frameworks that people use. In Europe, it's mainly the RRI framework, the Responsible Research and Innovation framework, that emphasizes anticipation, anticipate the challenges, anticipate issues, reflect on them. That's reflexivity, and then engagement, engage with critical stakeholders, and then action. So it's called the area framework, anticipation, reflection, engagement, and action. But having studied this framework and similar frameworks like the LC, ELSA, or responsible innovation frameworks, there are so many things lacking from our perspective. What are those things that we need to focus on as Africans as we're developing these AI governance mechanisms? So we have come up through a project called Strategic that we're working on, ironically funded by the European Commission. We have developed what we call the 5C framework, 5C inclusive framework for responsible innovation in AI or any digital or health technology. One element of the 5C is contest. And I think both Lillian and Agnes mentioned contest earlier on. We need to focus on context. Are these technologies being developed for our context? Context here doesn't just mean language, but also values, beliefs, principles, realities, expectations, and also our concerns, right? We need to consider our values. We need to consider the context. The next one is care and compassion. We need to understand how to safeguard people from harm as these technologies are being developed. It's not just that it discriminates against us or possibly excludes us from access, but also it can harm us, right? The use of some of these technologies can harm us. So we need to think about care and compassion, protecting people from the safety issues or security issues involved in these technologies. Another C that we are talking about here is collaboration. We need to build partnerships with anybody from the global north developing these systems. We don't want these systems to be developed in the global north and exported to us. We need partnerships where we think about co-ownerships and IP and everything, and also data, access to data and everything. Collaboration is an important aspect of the responsible design of AI and other digital health technologies. And then another one is compliance, ethical compliance, legal compliance, and technical compliance. Most often, developers and designers of AI systems focus on robustness, focus on technical compliance, the reliability of the system, but without thinking about the ethical compliance of the communities that they are developing these systems for, and also the legal compliance to possible regulations available in these regions. And then finally, continuity. What is the framework for continuity for making sure that the decommissioning of these systems, when they've completed their use, it's done responsibly? Thinking about ecological problems here. There are so many data centers springing up in Africa, right? There are ecological challenges to these data centers. There are ecological problems to the use of these data centers being built in Africa and all that. We need to think about how to solve those ecological problems in terms of sustainability and all that. So continuity is the last C of the framework. If we can consider these frameworks not as an abstract framework, but as a practical implementation of responsible innovation, then all countries, possibly all institutions need to focus on developing SOPs on how to practically implement this as they are discussing partnerships, as they're discussing the design, development, or deployment of these technologies for all of us.
Oh, that's great, Damian. And actually, you're pronouncing Kipsig is correct. That's a correct pronunciation. I really like the 5 Cs and especially the compliance, all legal and technical, and also continuity, especially with now the data centers. We have very few in Africa, and I think domiciled mostly in Southern Africa. They are really springing up, and I'm sure within the next few years will be all over the continent. So that continuity and sustainability, ecologically, I think it's a point that actually needs its own webinar even on how we are doing that. So thank you for highlighting that, and you always really highlight data colonialism very well. Thank you for that. We'll come back to you later. And now over to you, Lillian. Now, as we know, AI has tremendous potential to personalize learning and well-being support. And I'm sure this is something that you have experience with as you're developing the different systems at Uptake Education. So how can we harness that potential while ensuring the technology empowers people, especially the PWDs, instead of increasing dependency or digital fatigue? I remember Agnes also mentioned about digital fatigue, and earlier even Dr. Catherine Karekezi. So how can we actually do that, and based on your experience? Over to you, Lillian.
Okay, thank you. I think I'm gonna mention it on two aspects. One being from the platform point of view, and this is the medium in which the content is consumed, since it's digital accessed. One of it is, like I mentioned earlier, is we are moving away from just, like a techie platform website that works. We want one that is actually accessible to the intended persons. So, for instance, I think most recently, a couple of months ago, we actually did something. We put our own website platform on the test for the accessibility test. And so, what we were looking at is we wanted to ensure that the screen readers that are easily used by persons with visual impairments can be able to consume the data sets, the content that we have on our platform. So, and this is actually not even the content, because to some extent, the content we have done our level best, but now how about the accessibility of the platform? Since that's the first point of contact when it comes to now consuming the content we develop. So we had the assistive tech, navigate through the content, through the platform, from, the user journey, from the sign up to the login, to the platform, to the selection of the content that the intended user or the tester in this case wanted. And what we identified was we also tested our own assumptions, in the sense that we thought that since we have, we've laid out the platform in a, the user journey is pretty much seamless. But one thing we did not take into consideration was apparently the screen reader, the navigation is literally done through the keyboard. So forget about the mouse, forget about every other thing. So the keyboard, if the keyboard cannot navigate from point A to point B in a seamless way, that means you have missed the accessibility right at the start. They can't even get to the platform to access the content. Sorry. And this is actually now even an adult, not to mention the young learners that we intend to serve. So that now means that even from a platform point of view, we need to take accessibility and compatibility with assistive tech that we have. The screen reader, for instance, the text to speech, all these plugins that we are embedding, we need to make sure that even from the design point of view, especially now from the coders, the software engineers, when they are working on your platforms, you make sure that you have the inclusivity design in mind when they are doing it. So that was tested, and we got the feedback and changed what we needed to change. So the other thing is now on the platform, before I go to the content, was how can now AI help us, to improve the learning journey of learners and the learning pathways and whatnot. So how do we achieve adaptive learning, personalized learning into the content? So again, from the development of the platform, we make sure that this is embedded into the code, so that it can be like an AI-driven adaptive learning. So whereby when the learner logs into the platform, they're able to get like a personalized experience. These are the content that I like. I like STEM content. I like arts content. I like, so that now there's no, again, the information overload that we were speaking about, being like a lot of content coming at you at the same time. So we also made sure that that is, part of the inclusive design that we embedded. And also, one of the other things that also I would pose as a challenge to all of us was, I know maybe when we are developing our platforms, our website, we adhere to our brand colors, and that is okay. But there are some compatibility tests that we can all do to make sure that either the font size is okay, the color contrast is okay, so that now for learners, especially in the neurodivergent, who are neurodivergent, are able to consume the content in a way that is not, that is sensory, that is not affecting their sensory consumption of the content. So the colors are okay, the color contrast. And I can actually share with you like some of the free open source softwares that you can use to just check for that, if any of you is interested on that. So for us now, what this means is inclusion is not an add-on later. It is literally at the onset of the production, a development of whatever we are doing. It is from day one, we know this is how we are going to do it. And it's not by the way, when maybe we are finished with the work. And not to mention now when we come to the content in the product design side, because again, what we tested the assumption really fast was, developing the content. We used to say that we are better because we script the content from scratch. Well, that is okay. But how about, like I mentioned again, the co-creation bit, developing, for instance, we use teachers to develop our content aligned to the curriculum guidelines. How about involving teachers who teach either have a disability themselves? Like, for instance, the content for deaf learners, for instance, we use teachers who are deaf. So there's the aspect of the lived experience, how they would want to consume this content themselves, and also obviously guided by the curriculum guidelines. So for instance, we use inclusive features, sign language, audio narration, screen reader compatibility, font, size, everything. So at the end of the day, and then we also do a lot of testing. So this is supported through the focus group discussions that we have with the ecosystem, so that, we test, is it working? We test their assumptions. We understand, the user journey, what are the challenges, what can we improve on? We get the feedback from the teachers, we get the feedback from the learners themselves in terms of the mode of product that we use, product development that we use. We steer away from doing a lot of text and, PDF, lookalike, materials, and more of multimedia-based videos. So animations here and there, videos, gamification, some bit of simulation, and obviously having, taking into consideration the audio narration, the sign language, and also the most important one, especially for learners with visual impairments, taking into consideration the alternative text descriptions of every image, of every video. So I think in terms of the question that you've asked, I think that's how I would address it in two formats, the platform and also the content bit as well. Unless maybe there's something I've missed out, I would be happy to share on that as well.
Thanks, Lillian. And the point on actually testing your own website is really good. You tested it for, how easy is it to use for the people you're designing for, and stating that the user journey should be seamless, and even the compatibility test. And I think you can just drop that link to the free open source software that can be used to check those color contrasts. So that's really good, and how you're using AI for adaptive learning, using the deaf teachers to actually even develop the curriculum and actually be the teachers. So that's a really good point. Those are really good points on inclusivity. So you can just drop that link. And also, Damian, I think the links to the various frameworks you mentioned, apart from the 5C inclusive framework, the others that you mentioned, perhaps if there's somewhere on a journal that we can read, that would be useful. And so now, Agnes, I'm back to you. Now we've heard about you mentioned digital fatigue because perhaps of the poor design of the different digital solutions. We've heard about the people with neurodivergent conditions can be affected by the different color contrast. So according to you, what would inclusive digital wellness practices, what would that look like? And what is missing in the technology systems? What is missing and how would it look like for you? So that even now Lillian is here as the innovator. So according to you, what is missing? You might have alluded to these areas you were mentioning the challenges, but if you can now paint the picture for us, how inclusive digital wellness looks like and what is missing, how would that look according to you?
Thank you. Want me to talk about the missing, what inclusive digital practices are missing in the mainstream technology systems?
Yes, yes. How would that look like? What is missing and what should be included? So that now an innovator like Lillian and anyone else on this webinar know what is missing according to your own lived experience and people around you, so that we can see what is missing. We might be designing from our own realities, but then if we hear from your reality, it's something that can be put into practice.
Okay, according from experience and according from my colleagues, mostly the neurodivergent, there's not neurodivergent friendly features like sensory controls. There are many people who are neurodivergent, like those with autism or ADHD, they become overwhelmed because of the bright colors. Thanks to what Liliana said, they're designing website that is color friendly. So that's some website don't have that kind of options. So there is a overwhelming bright colors, flashing animation, pop-up messages, and autoplaying of videos where you are not able to, where there's an autoplay of video, a person who is a neurodivergent is having challenges of stopping the autoplay or continuing the videos. There is current screen dimmers that only reduce brightness, but they do not adhere to the distractions that a neurodivergent person can have. There is now customized time management. There are some websites that have some blockers where they set time on a person who is with a disability who is using the website, because someone who's a neurodivergent is not able to. Sometimes they tend to overuse or extend the time of using the computer or the software, the program that they are watching. So the thing that should be able to be put is like the time management or time tracking. You can call it like time tracking system, where there's a break or breaking a task into smaller time for a person to be able to manage the time. So the system they should incorporate that customizable time management or pop-up screen where someone is told you have been using this for this hour, take a break, or the chunking of tasks in different areas. The another thing is digital equity and accessibility. The software should be able to support different language and literacy levels, because we are not on the same levels. There are many wellness apps such as meditation or journaling are designed for people who can read fluently in major languages. They exclude those with low literacy levels and those who speak local languages and dialects. The inclusive tools should be able to offer audio guidelines, voice navigation, and multilingual support to ensure everyone can benefit. Another thing is low data and offline access. The many digital wellness applications, they require strong internet connections and consume large amount of data. This can disadvantage people who are in rural areas or those with poor limited connectivity areas. This inclusive solution should provide offline features and low data mode so that users can access support anytime without worrying about internet cost or connection problems. Another thing is psychosocial and mental health support. There is this something called smart and context-aware notification. Many people use a do not disturb setting to reduce distraction, but this can also block important messages. That is, inclusive awareness tools should also allow users to prioritize communication by creating trust and contact group and showing the urgent messages. This you can see it is there, but now they should be able to, in a way that a person can be able to separate the right person supposed to be accessing your calls or getting access to you. There's also accessible mental health services. This is according to the health. Many mental health and wellness apps they do not not follow accessibility standards, making it difficult for person with disability or the person with visual or motor hearing to use. The inclusive mental health platform should be designed according to accessibility guidance so that users can access support equally and independently. That is for a person with hearing impairments, counseling videos should provide captions or transcripts, and mental health content they use complex language without audio and simplified explanation. This should be put in a way that a person who is undergoing mental or health crisis is able to access the videos or to access the help without another third party coming in between them, able to access the help by themselves through the captioning or transcription of the audio visual. I hope I've
Thank you.
that's all.
Yes, thank you, Agnes. Your points on, the lack of sensory controls, especially for people with autism, lack of customized time management, where you mentioned something like time chunking system, uh, multilingual support. So those are really wonderful insights that I'm sure anyone building in that space will find useful and build for inclusivity. And now we are now just closing. So as I go to each of the panelists to just give their closing remarks and a key takeaway. The one question that I'll pose to each of you three panelists to answer as you give your closing remarks is finish this statement. An inclusive AI future for PWDs will only be possible if fill in the gap. Yeah. So as you're giving your closing remarks, very shortly, we only have 5 minutes. We'll finish the statement. An inclusive AI future for PWDs will only be possible if, yeah. Over to you. Let's start with you, Damian. Your quick closing remarks.
I think my answer will be if they are involved in the development of that technology. And involvement should not be tokenistic. It should not just be, oh, let's involve one person from this community here. It should be active participation in the development of the research agenda, in the design architecture, in the development of the technology, and also possibly shaping the deployment of that technology. So I think I always believe that you cannot design a responsible technology for a people without the people. So you have to design that technology with the people.
Amazing. Develop with the people and involve them in the technology development. Thank you. Over to you, Lillian, your closing remarks and finish our statement. Lillian, I think you're on this.
Okay, sorry for that. For me, I would say a model that promotes inclusion, wellness, even something we've never mentioned about digital empathy, also anticipating human needs. We are so, we become so, for lack of a better word, robotic. So we also need to, have that human feel. So building systems that, kind of make someone feel, yeah, I'm interacting with humans, I'm included, and my well-being has been incorporated from the get-go, not as an add-on. So I think that is what I would say at this point, and to also again, challenge ourselves in the way we build our systems and develop our platforms to have inclusion at the forefront of everything. So thank you, and yeah, have a wonderful rest of the day. Yeah.
Yeah. Thank you, Lillian. We said promote inclusion and have digital empathy. Thank you for that. Over to you, Agnes.
Okay, just as Damien has stated, as a person with disability, we should be included in when they're making these policies and designing the website. By embracing accessibility technology and assistive tools, we can ensure the equal opportunities to all of us, to everyone, person with disability, even able bodies. So we should be included in the table while designing this, because person who uses the person who using the software or the computer or the device is the one who knows where the thing should hurt him most, because as the user is the person supposed to be able to give the policy, give the example, give the idea of how this something is able to help them in such a way we are able to get equal opportunities in job, in employment, in education, in the health areas where we are able to we are being left behind, and in creating an economic empowerment for person with disability while using these devices is because it's one of the things that is measuring be able to help a person with disability be able to get economically empowered by using the devices. Because without this inclusion in the devices, a person will be able to empower him or herself economically, or even be able to improve their livelihood. Thank you. Thank you for
Thank
including
you.
me in
Thank
this
you so
talk.
much.
I've learned a lot.
Thank you so much. Yes, we have also really learned a lot from you. PWDs need to be included as the policies are being designed, and actually even when the systems are being designed. So thank you to our panelists for that insightful discussion. This conversation has reinforced that inclusive AI is about making technology work for everyone. We've explored ethical foundations, as Dr. Damian talked about, the design principles, as Lillian was talking about, and as Lillian told us from the lived experience, this is all about inclusion, and that the person being designed for should remain at the center. So thank you to everyone who has participated. Thank you so much for the amazing panelists. Thank you to Collins for organizing this. Let's connect on LinkedIn, follow all the panelists, and then let's keep the conversation going. Thank you, and over to you, Collins.
That was so wonderful. A panelist. I didn't want it to be off. I didn't want it to end. And it was quite informative, and it does enable us to see technology and digital wellness in a very, very broad and inclusive manner. And I understand those who are in that the disability space, person with disability space tech, I think you should take that into consideration. Without wasting time, I know our time has gone, and this panel has not done us justice. I tell you, it was for the good. But again, I congratulate you and thank you all for your contribution and the time that you've taken. And let's build this roadmap together. And I believe we'll be able to bridge the gaps that we have currently, ensuring that all sector is practicing digital wellness and also they are thriving without infringing or also affecting us mentally or physically. Without wasting time, allow me to go to the next bit. We are going towards our last panel discussion. And because time has really gone, I would like us, please, let's just break for 2 minutes, grab a glass of water, stretch a little bit, and come back so that we can go straight away to the last panel discussion. Then we close up for the day. I hope that's okay. So just have a break, kindly, then come back.
Hands aligned for
Okay. More minutes? That 30 seconds, sorry, 30 seconds. All right. The technology. Hold on a little. That thing. Okay, ladies and gentlemen, I think you had a wonderful break. Stretching is very, very helpful towards our health, and we should normalize and stretching and also walking at workplaces. And this session that we're gonna have is one of a kind because it's gonna touch on our workspace, wellness in our workspace, and also how best we can practice wellness. So if I am audible, kindly just let me know that I am. In the morning, somehow I took like 5 minutes talking to myself. Am I audible enough?
Yes, you're audible.
Okay, thank you so much. Yeah, so this evening we are having a great panel. We are having great experts, and while I'm talking, allow me just a bit to clean up some mess while I'm also switching on my video so that we start up immediately. These are the people, these are the champions who are in digital space, and there are amazing work that these great people have done, and I know how much efforts and the resources that they are putting so that we have a very well entities and a very healthy workspaces. I don't want to waste a lot of time, but again, I'll just have to set the pace, but at least helping the audience and the delegates understand the importance of this discussion, this last discussion that we're having today. So I'll start by giving a bit of story. I like giving stories, but I know I'll try as much as possible also to keep time. A few months ago, I visited a leading tech company, and it was so interesting. That was in Nairobi. So I saw a row of brilliant developers, guys who are so much working hard in their working environment, and some of the best minds ever. And perfectly, they were so much into server spaces, and servers were well kept, a lot of fun. And then you'll hear some funny sound if you are a technician. You'll you know how server rooms or IT centers normally look like. So, but when I look at the people, I saw a different picture because I saw the technique and the curved spine of a generation, and also I saw digital glaze, eyes redden, and by I saw a young men and women struggling because they really need to meet targets. There are a lot of issues that they really need to solve. So As IT strategist who is here, I can tell you if your server overheats, you replace it, right? And but when your human capital overheats, what do? When you are a developer and also you are a teacher, your children burn out. There is no spare part. If your children burns out, there is no spare part. You really need to invest so much on their health again so that they can come back to so that they can normalize their operations. So, ladies and gentlemen, I think at this time, I would really like to invite our speakers, and we have three speakers in the room, and one of the speaker is someone who I have known, and Craig, your wisdom is really transforming lives and influencing people, and you guide some of the world's most complex organizations, and we see what you do, and the world can see. And you've seen the data centers in all sectors, be it Africa and the US, as well as in the Europe. So my question is very spot on, but I would like you to take maybe around 1 minute of introduction that I'm not going to give you now. I'm going to give you while you started immediately the session. And we have another good speaker who is Victor Prince. I normally love how he does his things. I'm following him behind the scene, and then I bothered him so much because I know his contribution to what this is gonna make a great impact. And Victor, you are the transformer, and you pioneer ways to engineer judgment and the mindset at a scale most of us are still trying to grasp. And we have another young and beautiful lady in the room, and they are building, we call thriving city, right? Maureen Gikonyo. And I'm telling you, Maureen Gikonyo is really such a hardworking lady in the wellness space, and really making much effort ensuring our youth are healthy mentally and physically. And they are ensuring through City Rise and the role that she plays that the cities within Africa and beyond Africa are healthy and are thriving. So this brings me directly to the question that we have today. And before we dive into questions, I have to make a bit of comment as an IT professional. I know time is going, but I'm just trying to set the pace. So for years, I've worked in the IT space, and I've seen marvelous work in most of the IT technicians. Sometimes they burn out, but they don't want to speak up. But for years, IT managers and HR managers have lived in a different world. That there are people that, though IT provides Slacks, the team, the e-learning portals, you take the back end, the problems here and there, you provide the digital campaigns that keeps us, the organizations running. And I know some other departments, they also play that greatest role, that ensuring the organization run and everything works perfectly. Same applies to teachers. But HR, however much, I think somehow, maybe they are trying. Some now I understand most of the HR are trying to manage the burnout that follows after hard work. But how about the policy? Is it something that they have really actualized? And if it is not, what can we do for now to ensure that we integrate wellness within the space? Do we only focus on mental health and maybe burnout in workspaces without considering digital wellness? Do the companies or organization workspaces, do they understand what digital wellness really is about? Do they understand the amount of money that they are wasting because people are really have strained towards the end that they're not able to deliver? So this brings me now to Craig. We will start with Craig. I know he was not supposed to be here, and he even shared with me prior the video so that we can share. And I'll maybe through his, if he's present and he's able to talk now and he has moved away from the airport, I'll be more than glad to accept that without playing the video. And Craig, what does a healthy and enforced right to connect policy actually looks like in Africa and hybrid workplaces where the hustle culture is so strong? And I want you to stick to merge all your questions for because of time. And again, I will want you. I know again. Very few people globally who can balance the MPH and also MBA and also clinical coaching perspective as an elegantly as you do. And how do we prove to a clinical CEO that a rested employee is more profitable asset than a burnout one? So the floor is yours, Craig, and you may introduce yourself briefly, and then now you can take it on. Kindly.
Okay, so good day. Can you hear me okay?
Yes, loud and clear, Craig.
Okay, all righty. So, Colas, I'm still in the airport terminal, which is one of the reasons why I've done the video. But let me do the best I can. And if there is a difficulty, the video is always there that I can play as a backup where I address your three questions. Okay. All right.
Sure.
Okay. So my name is Craig DeLarge. I am a principal consultant at Wise Working Leadership, where as a global consultancy, one of our three core competencies is in the area of digital wellness education. The other areas are life sciences, leadership development, and digital mental health, angel investing, and strategic advisory. But today we're going to focus on the digital wellness piece. So, to the question that you asked about the characteristics of a healthy right to disconnect policy in an African hybrid work scenario, there are really three key points that I think are absolutely critical to such a policy. The first is going to be that the policy is backed up by an appropriate level of digital wellness literacy and education about the negative impacts of overconnection to work in the workplace, accompanied by an understanding of what are healthy and therapeutic levels of connection. That needs to then be tied to an understanding of digital lifestyles and what digital lifestyles are, so that that literacy can actually support people then improving and constructing for themselves a healthy digital lifestyle. The second piece then is going to be that the organization really works at psychologically safe communication and modeling by leaders. Because just because, we're seeing examples of this right to disconnect policy all over the planet. We're also seeing that when the organizational culture does not support it, people are very afraid. They feel very unsafe about using this right that's been given to them. We have to consider that policy is one thing, but culture impacts policy. And when there is not supportive culture, people will hesitate to use the policy. I mean, we see this in the United States where we give people unlimited vacation and they actually take less vacation than when we used to say, take 2 weeks of vacation. Interesting. And then the third piece, any cultural change is going to be successful where leadership is modeling and mimicking for the people that follow that this is, again, a safe policy to enact because you see me enacting it. I'm modeling for you the various ways in how it should be enacted so that we have a human manifestation of standard operating procedures. So, for point of brevity, I'm going to stop at that and happy to take any follow-up questions. But I think these 3 points are absolutely critical to we having effective policy in this area of right to.
Thank
Collins, you
Thank
there?
you.
Okay.
Yes. Yes, I am here. That was quite informative. I'll come back to you because I know we have a lot of follow-up questions that I would like to ask you so that to help the team be enlightened a bit. and also to help the HR who are in this space also to make the wise, one of the best decisions for organizations or workspace production. So I'll come directly to now Victor. Victor, I mentioned it, you are a pioneer in engineering human judgment, and you've looked at the curriculum of life and also learning through lens most of us can't even imagine. So your question is quite direct, and it's touching on digital community. And I would like you maybe a little bit to give a bit of comment and response as we look at the next generation. Does immunity needs to be elevated from a workshop a topic to a mandatory part of national education curriculum alongside basic literacy? I will want you again just to merge your two questions, and then I'll now follow up with I'll do a follow-up question so that we can close for the day. Over to you.
Okay, thank you so much. I hope you're hearing me. Is
yes,
my
yes,
sound
loud and
okay?
clear.
Yes. Okay, fine.
Yes.
Thank you so much. And Greg, it's good to see you again. Thank you for the opportunity. First of all, let's just take some two steps back. The first one is for you to solve any problem, the first and the most important thing you must always consider is how you frame a question, how you frame that problem. If you don't understand it, it becomes difficult to really get, the best result out of it. And one of the reasons why people go to the hospital, the most important usually, is just to diagnose and get a name for a problem. Immediately you get a name for a problem, then it's easy for solutions to be applied. So when we say digital immunity, first we have to be very careful to be sure, are we on the same level? Do we understand it at the same, point? Because my work in the human capital space, especially since I have the entire capacity to, what do you call it now, to go through the spectrum of human capital from a very lower space to a very, very advanced form. It gives me opportunity to see how the concept of human capital is not an event. It's not something you just wake up and think that in the next 4 years, you're going to build a human asset. And my journey has taught me clearly that everybody is born a human liability. The whole concept of education and learning is to develop someone and move them from becoming liability to become human assets. So the first question on the table for me will be the definition of human capital. Is it the same? Does Africa really have its own organic definition of human capital? Previously, Damon and, all even Lizzie referred to it somewhere. That somewhere along the line, we have to agree, what does Africa define as learning? Because if we're not very sure what we are defining as learning or what we are defining as education, it's difficult to box everything into one box and been thinking we're solving a problem, which what we're doing is we're just following a path. Data colonialism is not the only thing. We also have skills and competence colonialism. So to a large extent, because we have not been very clear in terms of defining what human capital means to us, it's easy for us to say we are building technology skills just so that we can provide services for the global community. So you see, that alone now changes the concept of what you call digital immunity. Because like Craig would say, all of this at the end of the day falls back to the principles of culture. And if there's one reality I think we take for granted is that Africans are not aware of Africa. Of recent, I've been doing a work called National Cake. And what have I been doing in trying to do that is my work has taught me that most Nigerians are not aware of Nigerians. In Nigeria, they don't understand the history of Nigeria. They don't know the processes and the principles, the events, and the choices that have shaped the mindset an average Nigeria carries today. And it's the same thing with Africa. Most Africans really don't understand Africa as a country. They don't know the events that have shaped the current mindsets of Africa. And then education, you really cannot enter someone's mind except you can go through the doorway of their culture. And so if you don't understand their culture, then education becomes one of those events that we're not very sure of what we're doing. So at the end of the day, the question is who define education Are we defining education based on our needs, or are we defining education because someone sits somewhere and set up a standard for certification and think that's what makes education? Why I'm saying this is that if you're not careful at the end of the day, digital immunity has become, for me, a culture war. A culture war between a people who are trying to preserve its people, educate its people, teach its people on how to develop the environment they are in, versus another people who have a culture of commerce and profit, which, as far as they are concerned, they are more concerned how many downloads out and how many eyeballs are going to see these apps. So at that level, it's now a game of who is more informed, who does most of the orientation. Otherwise, because every one of us were here discussing digitalization, the question I always ask is, how many persons in this room are part of those designing, from Silicon Valley? How many of them are here listening to us trying to humanize the process, humanize the experience, trying to make sure that that African content is present in the process of learning? So for me, you ask me, I want to come back to the concept of digital immunity to say first, as Africans, we must stop treating digital immunity from a perspective of looking at education as a technology project. We have to start seeing it as a human formation project. That lens, except we change that lens, we really may not appreciate the entire journey that goes through the process. And like I said, first, it has to start with understanding Africans and the African environment. Presently, we are facing a very, very big tragedy. And that tragedy is Africans don't understand Africa enough to know what is good for us, what sits and aligns with our culture. And that's why it's easy for us to adopt and explain. The best we can do is pick researches and data from environments who want to entrench this technology without necessarily paying attention to who we are as people and what.
Did we lose Victor?
Give him a moment, he'll be back.
Understand this background, then digital.
Okay. Excuse me, Victor, we lost you at some point. Maybe if you can go back a little bit. Okay, let's give him one less than a minute. Yes.
Okay, so I'll round up by saying this. Conclusively, this is what I would say for this particular opportunity you've given me. Number one is that it is not education or learning if a child learns how to operate a tablet, but that child cannot govern attention, cannot govern his emotions, cannot govern judgment, cannot manage movement, sleep, identity, things like truth, cannot manage social pressure, then that child is not educated or learning. That child is digitally exposed. Ability to have that in context is what will help us understand clearly that digital literacy may teach a child how to use technology, but digital immunity teaches children how not to be used by technology. Now, until we're able to make that awareness, until we're able to start driving that that level of intelligence and even providing data to that effect, then we're not getting it right. And there is a format I always use, and I say every digital literacy must have components, and one of the components, there are 7 key ones. The first one is attention sovereignty. Every child should be taught how to have the power and the capacity to deal with the attention as they wish it. They cannot be captured by that technology. The second one is emotional regulation. Every child should have the capacity to notice when digital exposure is producing anxiety, anger, envy, comparison, and all those trend effects. Then judgment discipline, the ability to pause and interpret a data and information at every point in time. Then truth immunity, the capacity to resist misinformation. Then identity stability, the capacity for that child to be able to avoid being sucked into what happens. And then body drain balance, that capacity to balance between whatever is happening online to their body and what their brain. And finally, civic responsibility, to understand that as I am enjoying and experiencing this, it is my duty, finally, to make sure that everybody in the environment, whatever choice I make, is going to affect my community, my tribe, and then affect my people, as a whole. I think I will stop here. I hope I've laid a few foundations for this.
That was spot on. That was spot on, and really, what you've said, it's very much important in terms of digital immunity and digital literacy. And digital immunity is like a safety jacket, which our young people can use now when the storm has come to help them through the storm. But digital literacy is just a way that would enable them to just used by the technology. So I think we should shift through digital immunity to digital from digital literacy to digital immunity. Thank you so much for that. And I'm coming back to you. Please don't drop. And I strongly believe that technology sometimes cannot mess us up. I don't want internet to go now. I want it to go after we are done. So, ladies and gentlemen, at this point, allow me to introduce a lady, someone that I know that is working in mental health space and tirelessly through thick and thin, ensuring that our youth are represented and also representing the grassroots of our cities. And she's a leader who manages global youth systems engagement to build mental health, friendly environment, and she builds the powerhouse that really would ensuring that our young people thrive. So Maureen Gikonyo, I'm glad you are here with us today, and I'll go straight to at least by asking you, there are a few pointers that we shared with you that we'll want and the audience will want to get light on. And your impact at CityRise is a testament to what happens when we prioritize youth systems, and also you see the heartbeat of the streets and the reality of the digital struggles that our young people are facing. That brings me even for the findings, the data that was shared yesterday, the rate at which young people are struggling. And right now, they can open up and they tell us, guys, we have a situation here, and we really need you guys to come on board and help us. And these now the systems that we are talking about, the systems we can build now to help these youths. And some of them even, they gave even some of the suggestions on how they feel they need help. Some have gone an extent where they need therapy. Some gone an extent whereby they need digital hygiene advocacy and campaigns within the grassroots. But this now brings me to your question, and from your vantage point at the intersection of urban life and also the youth development, what grassroots interventions have you seen that actually move the needle on the digital dependency? Then if you respond to that, then I'll come back to you again on with a follow-up question. The floor is yours, Maureen.
Thank you, Collins, and good evening, everyone. Good morning, good afternoon from wherever you're joining from. I'm really glad to be here today. I think as I was reading that question, the first question that came to my mind is, why really are young people turning to the digital world fully in the first place? And just to say that now, or in this era, that young people are coming of age with carrying so much of not only their dreams, but also facing a lot of polycrises in their communities and in the world generally. So things ranging from unemployment, academic pressure, lack of education, climate anxiety, social isolation, violence, unemployment, and also uncertainties about the future. So what we normally see as lack of motivation, and I think most of the time many young people can relate, that is always, why are you not working hard, why are you not motivated, are you antisocial? But that is a reflection of deep systemic issues that are happening in the world today. So it's not about telling young people to spend less time online, because that will only be treating the symptoms. And I'm always saying that if we are only going to focus on treating symptoms, then we will be going round and round and round and round. We will never solve the issue that is happening, and will not be addressing the causes. And that's why I'm very, I'm very passionate about social determinants of youth mental health. So we have to go back to what is causing this. And going back to the question on effective grassroots initiatives that I've seen is, I think the first thing is to mention that yes, mental health services are very important, and definitely we should continue advocating for youth-friendly services, accessible services and all. But when you go to the ground is when you realize that young people are asking for much more than just services. They're asking for communities that listen, systems that care, and spaces where they can be able to express themselves. And every young person has the innate capacity to discover who they are and discover that they are also part of something bigger. So things that we've seen happening is initiatives that foster a sense of belonging, because we are human beings. We can't exist in isolation, So anything that brings us close to our peers, to people, human connection, then that's something that the young people want to see. So things like, even when you go to the ground, you realize that the youth are coming up with initiatives that are addressing so many of the issues that they're facing. So things like peer-to-peer connections, things that foster community dialogues of issues that are directly affecting them, sexual and gender-based violence, unemployment, lack of education, everything that is addressing that, community dialogues, that's where they are. Intergenerational spaces. The other day we were speaking about how do we bridge ancient wisdom and contemporary science, because as Victor has been speaking, I've also been contemplating on Africa had a lot of ways to uphold our own well-being. Things like community, sense of community was very tight. And going back to the philosophies of Ubuntu and I am because you are, or Utu, humanity, sense of humanity, we already had that. And it's only how do we bring science behind this? We don't need to introduce new interventions from the West, but seeing that Africa already had its ways of upholding our own mental health and well-being, and how do we bring science behind that? Number two is also initiatives that are fostering sense of purpose in young people. So anything to do with community engagement. You'll notice that right now in communities, young people will come together for environmental agencies. For example, they'll pick up trash in their own communities. The other day I was in Mukuru, one informal settlement in Nairobi, and young people had actually, like, no one, not the government, not anyone had, brought this out in them. They just came together to pick up trash in their community, that sense of agency, things like youth advisory boards is not about, building systems for the young people, but it's building systems with the young people. So the young people have to be the center of that, and not only bringing them or viewing young people as beneficiaries, but also as agents of change. That is very important, to give ownership to young people. Number three is also safe spaces that bring out emotional expressions, or expressive activities. We've seen a lot of, I was actually conducting a research the other day, and one of the things that have come out from my quantitative data is that most young people are actually saying that they believe that the problem will go away, especially mental health problems. That's why they don't seek help, you know. And the other one is also fear of judgment, that I'm scared of, going to I know I have a problem, but I'm scared of what the community will say. And the backing it up with qualitative study is, what do the youth actually want? And they said that things like art that bring them together as an entry point, things like music, storytelling, faith and spirituality is actually a big factor. Culture is also another one. If you realize we have so many cultural spaces right now in Kenya, and when you go to them, is like probably 80% of people who are there are young people, because they want to connect with their cultures and going back to their roots. And the fourth one, as I end, is digital literacy. So it's not only teaching them how to use technology, but how do we also identify things like cyberbullying, online comparison, and how do we deal with that, and how does that affect our emotions and our behaviors, and how do we create safety around that? So for me, it's not only about abstinence from from digital spaces, but how do we make it more intentional? And also, how do we create support systems offline that young people can go to, and they won't only need to depend on the digital world, because the digital world is always an escape most of the time. Thank you.
I'm very sorry for that. Sometimes technologies power just went off. But anyway, I'm here. Okay. Can you hear me, Maureen?
Yes,
Am I
we
audible?
can. We can, yeah.
Okay, thank you. Thank you so much. We'll just continue. Okay, so I'll again go to Craig because, okay, allow me to go to Craig. That just messed me up again. Anyway, allow me to go to Craig. Craig, this is just a follow-up question, and I also encourage everyone who is in this room to make good use of the chat to ask questions, because that will really enable us to leverage the time that we have. Craig, my follow-up question, of course, you again responded to a bit of it, but we often hear the productivity versus wellness debate. And in your expert view, okay, there it is, yeah. In your expert view, kindly, how can employers reduce burnout while actually enhancing productivity? And should we move towards a world where organizations are legally required to integrate a digital wellness or physical wellness into digital workflow? Maybe you can take a bit of 2 minutes to respond to that.
Okay, can you still hear me okay? Yes?
Yes.
Okay, very good. Okay, I'll be succinct here. So, first off, I think kind of piggybacking on the last answer that I gave, this idea of practicing healthy digital lifestyles. I do think that, you know what, Colitz? I'm sorry. Pose that question again in one sentence.
Yeah, so
I got lost in the fact that you.
Yes. So, okay, so we often hear the productivity versus wellness debate. And in your expert view, how can employers reduce burnout while actually enhancing productivity? Should we move towards yes? There you are.
I got it. Okay. I got a little lost there. Forgive me. Okay. So first, practicing healthy digital lifestyles. Now, for those of you who might be asking, what does Craig mean when he talks about a digital lifestyle? I'm really talking about that combination of devices, channels, and content that any of us use rather uniquely unto ourselves in our day-to-day lives, in our work lives, in order to get whatever it is that we need to get out of digital technologies. Every one of us have a digital lifestyle. Very few of us think proactively about it, but that's a part of digital wellness literacy, is doing that. The other thing is that organizations need to take responsibility after helping people with their individual digital lifestyles, to actually carry that over to what I'm going to call healthy digital work styles and cultures within organizations. The third thing I'm going to say is that we need to be continually re-examining, what do we mean by productivity? So much of our current definition of productivity is what gets us financial profit. There has to be a continued rebalancing so that social and environmental profit becomes just as important as financial profit in order for us to be sustainable. Because what we're seeing right now, we have lots of financial profit, but with the lack of social and environmental profit, we're also finding that there's a lack of sustainability, and that's problematic. I think that this is where Africa's innately cultural longer view, understanding and respect for the past, as well as the long future, can really add value in shaping how we think about these sorts of things differently. So I'm going to leave it at that. Keyword takeaway here is sustainability.
Yes.
And I'll take any follow-ups you might have.
That's very right. Sustainability. That's the keyword. I'll go straight direct to Chris again. Chris, I just want to ask you about knowing your passion for scaling human potential. And this is something that I'm very passionate. I am into the war of fighting the sedentary lifestyle, and I'm strongly using sports and also in engaging the community in that, and also integrating digital wellness as well as mental wellness within the program. So how can schools natively integrate sports and somatic movement into digital learning environment? And what is the evolved role of the teacher in identifying these unhealthy digital ghosts among their learners? The floor is yours.
Again, I say thank you, and I think the fact that every of the panelists, we all aggregating towards somewhere, because sometimes we are caught up in this. The world presently is caught up, whether you're dealing with poly crisis, meta crisis, all of them walk up in what they call the crisis of crisis. Everyone seems to be more confused. And so in the midst of confusion and chaos, one of the most important things you need is clarity of purpose, clarity of source, clarity of destination. And if you don't have that clarity, every solution looks okay. Everything looks like an adapt. The first thing is that we have to first learn how to reframe where we are heading to. Every solution is good, but it's not every solution is good in context. So ability to have that clarity of purpose, for me, I think that's what we're still lacking. And even if we're discussing digital literacy, even if we're discussing digital immunity, this is not in isolation, don't forget. This is an entire cultural thing. It's a process. And oftentimes we fall into the trap of thinking that we can solve most of this issue by just focusing on the young. Maureen, you're doing a very beautiful work there. However, there is a need for us to understand what they call the 3-generation metrics. On one side, we're talking about an emerging culture. On another side, we're talking about those who are making policies. And so until we bring those who are making policies and the younger one who are trying to develop, adapt and develop new principles to be able to adapt on the challenges at the same frequency, we're going to have a pushback of generations where we have the older generations who already are well established in policy making domain. And then we have the younger one who we're advocating, placing, encouraging, inspiring them to find themselves in the best place they are going to negotiate the system, not being at par. So you see a policy. I'll give you a personal experience. My work, one of my major work over years, that one of the major challenges we face in Nigeria is that most Nigerians honestly do not understand Nigeria. And because they are not Nigeria aware, their creativity and innovation at the end of the day are not sustainable, like Greg will say. So we build the best of ideas, but the history of Nigeria will truncate them. And you can expose that even to the larger African community. The same thing happened. You get to realize that most Africans seems to be developing good ideas, creativity, innovations, and solutions. But largely speaking, the history of Africa, the trajectory of Africa, the fact that Africa has become the new bride and everybody wants to make from Africa has become a contention to every idea, every solution on the table. So that for me is one thing we must get very clear. One of the saddest things I have been trying to push back previously is presently is that you notice most people propagate this concept of what they call the goldfish focus. Is what the goldfish focus, where they tell you the lifespan, yes, attention span is very low. Now, I wish you get to see most people, even in the educational space, try to tell you, look, people can't read book anymore. Don't publish books anymore, because the attention span of the human is less than the golden fish. And this was just a marketing research that was pushed with Microsoft at a point in time, because they had certain intentions for their product. But now it is almost becoming a cultural norm to hear, no, people don't read anymore. If people don't read, what is Greg doing? What is Maureen doing with research? People read. But because that has been used consistently, a lot of people are now even using that to develop programs, to structure, and even fall into that trap. And so the need, therefore, for me is that establish that mental sovereignty. I'm big on mental sovereignty. Get to that point where we own ourselves enough so that we can be able to look at things practically based on where are we coming from and where we are heading to. Because even when you talk about sports, look, let me close by that. In principle, even if you're looking at sport, what do you call the sport environment? It is what you define. Most people are now seeing most of these interventions, actually, that's the word, as intervention is just tag along, not as part of what makes the original, the wholesomeness of learning. Because a child has to be taught. We have to understand that a child does not learn with brain alone. The child learns with their body, with their emotions, with their movement. So even when you're discussing sport, it means we have to look at it from a very holistic lens. And oftentimes in the school system that I know, most teachers are not even so well equipped to have that holistic worldview. So even if you bring them to an environment where you want them to bring specific value in terms of digital immunity, the question is that how what's the capacity, what's the skill, what's the competence? Is digital immunity, is it presently in teachers' curriculum? Are they teaching the teachers this? Because they don't know it, they don't even know how to bring the value. Yes, UNESCO, world organizations are pushing this, but you and I know most of these bodies, the more the voice, the more the influence, the more the investment, the more you make the best out of it. So I will end by saying, in such an environment, the key thing that is very important for us is that before focusing only on digital immunity, whether in sport or whether for teachers, our educational curriculum naturally should have a structure that the mind must be given the proper attention. The body should and must be given the proper attention,
because learning has to be designed around the human biology. Emotions needs to be given the proper attention. Identity, the African identity now for most young Africans is a struggle. They really don't know who they are, where are they coming from, where are they heading to, because there's a challenge between the generational gap. The older one seems to say, well, I think we've tried our best, we've given up. So the younger ones are trying to solve the problem that is for their generation, a problem coming from a previous generation that was unsolved, and also the responsibility to see how best to create a safer generation for the unborn generation. So you see, the need of identity needs to be entrenched. Community has, Maureen made a lot of statement of that, and which is true. Most young ones are feeling naked, they're feeling isolated. And because they feel isolated, and whether you like it or not, digital world is a coping mechanism. They jump into that space. So giving them instructions is not enough. We need to first equip their mind and their sense of awareness with things like safety, help them understand what identity, emotions, and the mind is. It is when they understand this, then they can tackle whatever the digital space brings. And don't forget, discussing it against what is available presently. The world of the digital space is consistently also investing money, investing research in trying to accelerate how to make an average human being a consumer of this item. So it means, therefore, that it's not enough for us to just discuss. We also have to propagate, increase our voice, make more advocacy, have more hands join at different level for different generations, just so that at a policy level we are doing this. At a younger level, we have young ones who understand the reality on the table, so that they start changing and developing a mindset that can help them manage all of this. That, if we can do that, then what happens in school during sports, what happens with a teacher now becomes organic and sustainable. Greg used a word that we must never forget. The key word here is sustainable. We can't just do a band-aid, just do what looks good today, and tomorrow we'll come back again to the table to discuss. I think I will stop here for now.
Thank you. Thank you so much. That was indeed helpful to me. I'll come straight to Maureen. And I still encourage everyone in this platform to maybe you can put your question on the chat. Also, we may get maybe one or two people to ask question directly because our time do not allow. So Maureen, this is my follow-up question to you. And can we use sports? Just the other day, we were talking about sports and how we can integrate wellness within the sports unit. And can we use sports and community activities not just as hobbies like we do it now, but as a clinical tool for digital detoxification and resilience? And finally, what high-level partnerships do we need to make this digital wellness of ecosystem a reality across our community?
Okay, thanks, Collins, for that. And the answer to the first question, definitely yes. So I think the first thing that comes in mind when we hear about sports, especially, it's always physical health. And for me, it was, oh no, please, I don't know if I want to participate in sports until I came to realize that, is far much more than my physical health, and there was this meme yesterday I saw, and I was like, oh yeah, that sports is actually getting recognized as is a very important tool for mental health and well-being, because somebody said that if you're not participating in any marathon, or you're not joining a walking club, or you're not watching football right now, then I don't know what you're doing, And why is that happening is because sports creates far much more, or just upholding our physical health, but also it creates a sense of belonging because people come together, a sense of meaning, giving us sense. And I think one of the biggest thing that we hear, and especially when young people are about or are experiencing suicidal thoughts, is always, what is the meaning of my life? So giving a sense of meaning that I can keep moving because I have this community around me, because I have an activity that upholds my mental health and well-being. Also giving a sense of purpose, because people actually use this for economic purposes. So giving them a sense of purpose and also creating teamwork and community. So it goes far much more than just physical health, but also now, not now, like using it as a tool for mental health and well-being. So when young people use sports and in various communities, which I have seen, and also creative activities and also community initiatives, they are also developing protective factors for their own mental health and well-being, because as you know, there are negative coping mechanisms and positive coping mechanisms. So looking at the positive coping mechanisms, helping young people with emotional regulations, helping them with communications, because of course, as you play sports or as you watch sports, and I've realized that even when we are watching sports, is always like we prefer not to watch it at home. We prefer it when it's somewhere where there's an audience or where there's a community. So also creating communication skills, leadership skills for young people, and a sense of agency, problem-solving skills, but also while doing all this, they are building a community around them and giving something to young people that is missing in today's world, human connection, because we have so many things going on. You know, we have 99 problems or more than that. So human connection is actually going to the back end, that people are like, okay, where do I get my next meal? Where do I get money for school fees? Where do I, like there's always a lot of things going on in our heads. So human connection is taking a backseat slowly. So right now, I mean, sports and community initiatives gives that, the human connection that we are lacking, or is a very, rare asset right now to human beings. So blending both, I don't think we can ever get rid of online engagement. And to just say the truth, that it's also helping in so many other things like learning, also bringing the world together from different, we don't have to always travel everywhere. It's bringing people together, even now as we speak and as we're doing this. So blending that and seeing how we blend online engagement, offline engagement is something that we need to closely look at. Going back to the question on which institutions or what partnerships can we look into, is for me is this is, I mean, anything to do with mental health and well-being becomes so complex because it can't be solved by only one institution. It has to be a mainstream. It creates a challenge to bring people together, but it also creates a very powerful opportunity to build a movement around a certain cause. And because mental health is touching on a lot of, different things, and digital wellness being one of them. So one of them is the government, definitely, because the government has a duty to respect, protect, and fulfill human rights, and health is one of that. So the government has a mandate to come up with policies that protect young people online, but also they have a mandate to invest in offline environments that support well-being. Things like ensuring that cities or rural areas have green spaces, have sports facilities, have safe public spaces where young people can be able to meet. They have youth centers, they have quality and accessible education and employment. So the government has that mandate. Education systems or education sector is another one, to focus on digital well-being. As I said earlier, how do we recognize cyberbullying? How do we recognize comparison? How do we build a movement towards digital well-being? Healthcare is also another sector that needs to be involved. So recognizing that problematic digital use is part of a broader mental health assessment, and also ensuring that services remain youth-friendly as we include this. And then tech companies also to build digital platforms that are prioritizing well-being rather than just maximizing attention or how many views do we have. So we want to see that digital well-being is at the forefront of that. What are the civil society organizations are also one of the most trusted entities at the community level, because most of the time they create culturally relevant programs and initiatives that are relatable to the communities. So, and some young people prefer never to reach out to, clinics or health spaces. So that gap is where the CSOs cover, that they create programs that actually goes to the ground. And the last and most important partner is the young people themselves. We cannot create anything for the young people without including the young people. And it's not only about bringing benefits to the young people or, we've built these programs is for you. No, it's about creating systems of intergenerational collaborations and bringing young people as equal partners. Because believe it or not, there are already solutions that young people have on the ground, and they've not been recognized. Funding has not come to them. They're actually funding their own initiatives that help the communities or the young people around them. So how do we bring much attention to the initiatives that they're coming up with and collaborating with young people and giving them a sense of ownership? Thank you.
Thank you so much, Maureen. That was quite informative, and I don't want to waste a lot of time because we were supposed to end by 4 p.m. and I've seen it has gone 30 more minutes. But allow me to ask the audience if there is anybody with a question. Kindly, maybe you can raise your hands. I can give room for 2 people or 3 at most, so that we conclude for the day. Do you have anybody with a question? Maybe I can see your hand. You can raise a hand. I'll be more than glad. Okay, so to mean there isn't. Anyway, so I'll give each one of you 1 minute for parting shot, so that we close this session officially. I'll start by Craig.
Yeah, so can you hear me okay? Yes?
Yes.
Okay.
Yes, you are.
So once again, Collins, you and your team, thank you so much for putting on these symposia. I always find them very helpful. And this, you're playing a key role in advancing what is a very important discussion on this topic of how we responsibly, ethically, and productively handle this tsunami of digital activity that's happening in the society for ourselves, our children, and our grandchildren. So keep up that good work. I'm just going to leave everyone with this idea of digital lifestyle. Please examine it in your own lives. Look at it in the lives of your children and your community members and family members. Educate yourself about how to construct and practice a digital lifestyle that actually helps you to sleep, eat, relax, have better relationships, and move more. This is the basis that we have to establish in our relationship to digital technology that then allows us to do every other productive thing that we intend to do. But if we don't have healthy digital lifestyles, we will not have the energy, the will, or the level of health that's necessary to do all of these other things that we're talking about. So I really want to encourage everybody around that. And I'm available to anybody who wants to have any sort of follow-up discussions about this. Take care and be well.
Thank you so much. Let me go to Maureen.
Yeah, thank you so much, Colin. So I think the one thing that I'll say is that young people do not exist in isolation. They exist in families, they exist in schools, they exist in healthcare, they exist in community spaces. So digital well-being cannot only be a technology agenda, it's also a public health agenda. It's not just asking young people to stay off their screens, but also asking why. It cannot be only us saying, oh, we need to develop better apps, or we need to, all that, focusing only on the technology side, but we also need to focus on the social determinants of well-being as a whole. So looking at public spaces that are safe, creating green spaces within cities, not only developing infrastructure or tall buildings or skyscrapers. No, how do we create green spaces? Because nature is one of the most untapped resources. And also things like community spaces or safe gathering spaces for young people. So yeah, that would be my parting shot.
Thank you. Thank you so much, Maureen. I'll go to Prince.
Yes, telling you thank you and appreciating your work. Actually, the Collins and team is actually all in order because it needs to be given. You need to have those who invest the time, the energy, the investment to make this public, and also to cause so much awareness. So I want to begin by saying thank you. And my work in the human capital engineering space has taught me one key word, that you can play with anything, but don't lose your mental sovereignty. Among every other thing, don't lose your mental sovereignty. If there is one thing, unfortunately, we are struggling with in Africa, is somewhere along the line we lost that mental sovereignty, that capacity to take two steps back and reevaluate a solution, reevaluate a trend, reevaluate any promise. Because if you don't have that capacity to reevaluate your environment, your relationship, your connection, your adoption, innovation, and every one of them, oftentimes even a poison can be served to you on a platter of gold, and you take it and then you kill yourself in the process. That has been one of the greatest killer of the environment. So I really would beg that as much as possible, I love the fact that the quality and the content of even everyone that has been on, just not only this panel, across board, have been people who understand there is a need for us to reframe our definition of education, reframe our definition of learning, reframe our definition of productivities. Why? Because if there is one thing the online space has done, that is insisting on creating human being en masse, irrespective of culture, irrespective of belief. Why? Because the more you become mass, you become a consumer. And the more you become a consumer, every product is something you can click on and download. So there is need for us to recover ourselves. If you can recover our mental sovereignty, every form of solution becomes organic. Whatever we need to improve on, we improve. Whatever we need to leverage on, we will leverage on it. Whatever we need to adopt, we will adopt it. But first and foremost, it must come from the place of who are we? Then other things will follow. I think I'll stop there and I say thank you for everyone that has been on the call.
Thank you so much, Victor. I really appreciate it. I've just gotten a private message from Dr. Siraj that the remarks and all the questions that he has is very important. So even before I close up, maybe Siraj, you can unmute yourself. Take maximum, not more than 1 minute, kindly. Dr. Siraj?
Okay, thank you very much. My name is Dr. Siraj. I'm the East Action Organization First Executive in Ethiopia. It's the NGO. I appreciate, this program. That's why I spend this time, because this is a wide program. It includes, this is a public health. It includes all public health importance in relation to epidemiology, because I have a master of epidemiology. So what you are talking is the all aspect of the life in relation to digital in recent, especially in Africa. So this is public health importance in all Africa. What I would like to recommend is, this is a word program that needs, to be invited a lot of intellectuals and a lot of, it should be NGO involvement, local government, non-governmental organizations, because they can play a more role. So my suggestion is, just to say, thank you very much for establishing this network, and this network to be very productive, it should be widened and should be invited to different NGOs in Africa and different intellectual. So later on, this network can be, at a globally all in Africa, most known network. I'm sure, because we are talking every significant, even I am sitting in my home, and that is around. What you are talking, you are touching my problem also, including me and my families. And so this has impact for productivity. When you see the office in the government or in the public, most people are watching, TV, and non-related to working hours due to. So this is a negative impact also. So this digital has a negative impact and positive impact. Therefore, encouraging a positive impact is such kindly in relation to public health is very important. Therefore, thank you very much. For me, I will try to endorse this network to individual now in NGOs. So please, what I would like to finally say, please try to widen this network.
Thank you. Thank you so much, Dr. Siraj. And we really thank you even for taking your time. These 4 hours just listening and taking notes. And because of your presence here, you will be able also to help us to scale up in your country so that we reach out to different organs or organizations. So at the end of the day, we'll have to have ripple effect across Africa and beyond, because Africa is thriving as Africa is rising. Ladies and gentlemen, I think that's gonna be enough. But this has been an absolute masterclass. Craig, Maureen, and Prince, that was really wonderful and was really informative and educative. And we don't take your time for granted, because we believe all that we've discussed today has really played the greatest role in our lives and in how we do things, and also the policies that we have in our workplaces. And those who are in the community and working with the youth, they know the button that they can press and how best we can work together in ensuring that we develop digitally well communities across Africa. Thank you so much. And Craig, you've given us the corporate blueprint that will never fade away. And I also appreciate Victor, who has also done so marvelous. And also you've challenged our cognitive architect. We really need to go back to the drawing board and to change our mindset. And again, thank you so much, Maureen, who also have really helped us in ground. You've really enabled us to ground ourselves and also see community as a powerhouse. And through your insights, I strongly believe that we'll be able to have the best approach possible, even in scaling up and also having partnerships that will ever last, and ensuring that mental health and digital wellness work hand in hand. Because as we live in a connected community, we really have to have the two working hand in hand, so that we have a healthy and a thriving community. So to our delegates who are in, I would like to thank you all for taking your time, and also thank you all even for your contribution throughout the session on the chat. And to our previous speakers also, I would like to send my gratitude towards your contribution and your time. It's not in vain. So just to conclude, I know time has gone, and we started while we were at 47. Now it has gone to 22, and I know some also want to leave. I would just like to again There you are, Craig. Sorry. Okay. All right. So there is something coming up. Again, I would like to invite all of us to consider joining the CoDEW. This is a small baby which is coming up to bring together all stakeholders who are having interest in digital wellness. So that we start building up, and also we start building the capacity for the youth that we have in our communities, and also influencing the companies and the organizations that we work together with, and also we have within our communities. So I earlier, I think the team shared the email address. So if you want to be part of the CoDEW, and also we'll share more information on the email, kindly reach out to us. We'll want as many people as possible. As Dr. Siraj has said, we really need to scale up and have a big network in this. Again, I advise each one of us again to be able to join the advisory board and also the workforces that we shared earlier. And more information again will be shared with the report together, so that we have a team of rich, like-minded and knowledgeable people who are able to influence policies that we have within our country, and the team that can directly link us to the ministries, and also the parastatals, and also the tech companies, so that we work together as a team, not just coming up with an application, and then after that is when they involve the people without even considering the wellness of the people that will be using the applications that they have developed. So ladies and gentlemen, I believe that a lot will be shared on the email. So please feel free to reach out to us, and the CoDEW team will reach out to you, while we are also in search of the directors of the CoDEW to run the digital wellness space, and also to ensure that we get enough resources that we will use even to start some fellowship programs that will really focus directly on digital wellness, so that we have well-trained people on digital immunity who are able to make or influence and train their fellow peers within schools, within the sports clubs, and also within the community and the workspaces that they are in. So at this point, allow me to officially close up for this summit, this symposium. And I strongly believe we'll have so many virtual sessions to build up this relationship, and also to share the specific areas that we can focus on as a team. Allow me to close now officially. Enjoy the rest of your day. And again, see you soon when we share more about our plans for the future and our upcoming series of roundtables. And I believe even the delegates, you will get time to participate in that. Thank you so much.
Be well. Thanks again.
Thank you. Bye.
Bye. Thank you. Thanks.
Bye. Thank you.